cases of people suffering from the knee joint pains. Earlier we used to have knee pains, people above 60 years, 70 years, but now we are seeing cases just from 30 years onwards. So wherein we see the different stages of knee, as you can see, there is a regeneration in the knee joints that happen. It could be in the cartilage and the bones as well. And with the help of ozone that we are doing this therapy, it helps regenerate this cartilage, and people suffering with knee pains, with osteoarthritis up to grade 3 and initial stages of grade 4, we help them prevent or postpone the surgeries. And the special therapy that we use is the prolozone therapy. And I think the slides are here and there. So apart from that, we also take corporate sessions on prevention of neck and back pain, as we have been seeing more emphasis on more issues of the spinal issues that we see among people in professions of being software professionals, or it could be people sitting for 8 to 10 hours like judges, teachers, where they will have to do a constant forward bending, desk for correction and all. So we see these kind of issues. And so we have spine care management and preventive spine care and knee care sessions that can be taken as a corporate wellness program, and we offer that. Bit of, I think this was in the beginning. So basically that's about naturopathy, and little about myself. Since 25 years I've been practicing. And naturopathy goes with a holistic approach of treatment. As I shared, treating the root cause and not just the symptoms. So basically, naturopathy believes that our body has remarkable recuperative power when left alone. But unfortunately, we intervene too early, too much, and suppress that one. And this is where all the nature cure philosophy comes into picture in initiating or activating our own natural healing powers. This is a bit about our center, Sangri. This is an East Maridpalli with about 3-floor structure we have with all the facilities. And these are the services that we do with pain management, major treatments belonging to acupuncture, ozone therapy. Thank you. Yes.
So, you mentioned about the ozone therapy for the regeneration of
yes.
the knee joint. Yes. So, our today's session here we want to discuss that how the person who has already gone for the PRP sessions and all, so can this be worked along with that?
So, people who have already gone for PRP, and I'm sure they would be in their grade 4 of osteoarthritis, they would have visited, and then if they are
not sure. I mean, this time people go for the first level, also they go for the PRP to prevent.
correct.
So, up to what level it can be implemented?
That's what, up to grade 3. Once we examine exactly their x-rays, and up to grade 3 and initial stages of grade 4, where there is a bit of cartilage still there, and whatever the regeneration has happened, once we examine their physical examination we do and the x-rays, depending upon that we take a call how much it can help.
But it can go parallel.
It can go parallel as well. Absolutely.
Thank you. Thank you.
Thank you so much for your patience listening. So next we welcome Dr. Ambika, a passionate pediatric nutritionist and lactation consultant whose work empowers parents and children alike. She's going to enlighten us on the topic raising super kids, nutrition habits that build immunity and lactation.
ఎవరు మాట్లాడుతూ వాళ్ళకి counselor and also a certified diabetes educator, and I've been practicing for the last 9 years. I have also practiced before that, but independently practicing for the last 9 years. So first thing, I'm here to talk on the topic raising super kids and the key to right nutrition and immunity. We all see that kids today are lacking in one thing, and that is immunity. That is making them either obese or like lower in their school studies or in their performance, and also leading to lifestyle diseases later. So let's talk basics. Where does it all start? It starts in the womb of the mother. We see a lot of differently abled kids these days, especially autism or other behavioral issues kids, and that all starts in the womb of the mother. And then comes pre-pregnancy health and hormonal status definitely matters. So a woman marries and trying to get pregnant, or even before she thinks that she wants to have family, she first needs to start working on her own health. And then health of the man is also equally important because the sperm is coming from the man, and the health of the sperm is very important if you want to have a healthy kid. And first thing, breastfeeding. This is something nobody can ever negotiate with. I have just written here some problems that are associated with breastfeeding and also the solutions for it. We have to exclusively breastfeed for 6 months and then breastfeed for 2 years. While exclusively breastfeeding is nothing apart from breastfeed for the first 6 months. And after 6 months, we can start with complementary feeding along with breastfeeding for 2 years. One main reason for this is 95% of the iron comes from mother's breastfeed, and this is scientifically proven. We all try to give iron-rich foods to our kids to improve their immunity and for many more reasons. Just breastfeed the kids for 2 years and you'll see that the kid is already immune enough. And then the problems that are associated with breastfeeding. First one is premature babies. How can we breastfeed at that point? Well, express and feed as much as possible. A lot of, there is a myth that breastfeed starts generating only after 3 or 5 days. No, none of my patients have faced this problem. Breastfeed starts producing as soon as the mother has delivered the baby. The placenta is removed, estrogen and progesterone immediately goes down, prolactin is high, breastfeed production is already started. Then comes latching issues, mother being sleepless, flat or inverted nipple, or any other temporary conditions, meet a lactation consultant. Tongue or a lip tag, meet a pediatrician, analyze and discuss, and they send you to a dentist who can release the ties. And then low milk production, meet a lactation consultant and a dietitian again. Now, next, after breastfeeding what to feed at 6 months onwards. This is very, very important. We cannot anymore rely on the dal ka pani and the chawal ka pani. So why do we need to think it is important to give the right nutrition to the kid, to meet the energy and the nutrition requirement along with the breastfeeding, because it bridges the gap. Iron deficiency, yes, very well known in kids these days, because as soon as the kid has started complementary feeding, their breast milk intake slows down. And then micronutrient needs. There is vitamin A, D, K and C, which are very much important for the immune function, vision, bone health and other bodily functions, and for that it's important that we feed them right. Next comes support growth and development. As the kid has started growing, once they start crawling at the age of 8 or 9 months, they are trying to stand, they have a lot of hand and leg movements. That time we need to change their diet again. Physical growth, because it properly the proper nutrition fuels healthy growth and weight gain in the kids. Cognitive development, which is essential for brain development and it is very rapid during infancy. Then comes immune function. There are a lot of vitamins and minerals which help strengthen the immune system and they also protect against various infections and reduce risk of chronic disease. The right diet now will make sure that there are no chronic diseases developing in the kid later. So if there is healthy eating habits established early, that can reduce the risk of chronic diseases later in life. Now, let us look a little at what are the nutrients that are needed for a growing child. First one is omega-3 along with DHA plus EPA. People only talk about omega-3. They also supplement the kid. But what about the DHA and EPA that goes along? Let me give you a small example of omega-3 for kids. Flax seeds is very good. But flax seeds along with curd, homemade cow milk curd, also supplies DHA. And the ground flax seed releases EPA. That is how you are supposed to make sure that your kid is getting right nutrition. This is the time where brain development is at its peak. So if there is right omega along with DHA and EPA for the kids, this aids focus, learning, sleep, mood and also reduces inflammation in the kids. Kids these days are highly inflamed, not because of like what they are eating externally only, but also because of the internal development that is already going back because of in the womb. Next is probiotics. Now, gut health is foundational. Probiotics aid digestion, reduce bloating, improve absorption and also boost immunity. So apart from curd, what is the other probiotic that we can give to kids? The kanji water that was being supplied outside. Dairy probiotics are the best. But we cannot have kids directly drink it any time of the day. It should be generally given after meal, especially after dinner, so that they sleep better and the gut health is actually working at its optimum level. And next one is vitamins and minerals. With school stress and also growth, they need balanced nutrients. They support immunity, bones, healing and energy. So how can we give vitamins and minerals to kids? Vitamins are from fruits. Minerals are from vegetables. Kids need 3 servings of fruits every day and 6 servings of vegetables every day. And we are giving them only dal rice, curd rice. Now we can imagine where is it all leading to. So we need the right combination of foods here. Now, in kids, when to see a dietitian, like a lot of people tell me like, why do we need to see a dietitian for our kid? Well, some examples. If the kid suffers from juvenile diabetes, if the kid suffers from ADHD, a lot of people get confused with ADHD and autism. ADHD is a behavioral disorder which is happening because the kid's diet is not right. We cannot cure autism with the diet, but we can control the behavior of the kid. It gets a little easier for the parent to take them to therapies and to manage with the kid. Next comes low immunity. Kid falling sick seasonally, absolutely fine, and that is needed. That is they get immune to the different kind of viruses and other bacteria they're getting exposed to. But kid falling sick very often, then that's calling you for pediatrician and doctor's scripts. Then yes, the kid is low on immunity, and that needs a dietitian recall again. Height and weight chart, not as per the growth charts. Always go to a pediatrician and ask them to analyze the growth chart of the kids. This will definitely help you understand how is your kid growing. The kid is underweight or overweight. The kid is under height or over height. Everything is a problem and that needs to be analyzed and corrected with the dietitian. Picky eaters, my kid doesn't eat this, my kid doesn't eat that. We have to make sure that this food should be there for him, then meet a dietitian again. And kids majorly involved in sports activities because there are a lot of nature parent tests happening. They do need a dietitian support to make sure that they are growing better. Now, a small Q&A session just to bust some myths. First thing is, I want the audience to be a little active here. Makanas are very healthy and nutritious, should be taken in abundance on a daily basis. Any particular reason for this?
Salt?
No, makanas can also be non-salt. Because makhanas are also very high in potassium and phosphorus. Excess potassium will hamper your kidneys. Excess phosphorus will hamper your kidneys and heart.
So what is the maximum quantity what the general person who is not having?
Whatever fits into your this list. When we say handful, people think handful is this. No, handful is this. Next, kids need a lot of calories, so it's okay to give them fried foods on a regular basis. Yes, because fried food is high in fat. The oil that you're frying in is already not stable, it has turned rancid. So when you give them a lot of fried food, they're taking inflammation along with it, along with excess fat, which doesn't know how to burn the small amount of carbs or proteins that they have received along with that. Next, kids need a lot of fat and should be eating a lot of ghee.
Not lot of, but
yes. So basically, we tell everyone that an adult can take about 3 to 4 teaspoons of ghee a day. Same applies for the kids as well. Their brain is made up of fat. They need a lot of fat, but that need not be ghee always. There are many more sources of fat that you should be adding for better development, but ghee as a saturated fat is good only on like 3 to 4 teaspoons. Kids should be eating what we are eating.
they need more carbs than us.
So basically here what I mean is kids should be eating what we are eating is by 1 year old kids should be eating from a family pot. So here kids cannot eat a lot of spicy food, they cannot eat a lot of oily food. The family has to compromise a little, cook depending upon what the kid needs, and the kid should be eating what we are eating. This way the family will also correct their diet. So it's a win-win situation on both the sides. And these are 2 small recipes that I wanted to share. One is yogurt bites. A lot of kids ask for ice creams or lollies and all those things. This is something I always keep ready even for my own kid. I have given one small example here of yogurt, kiwi and banana. You can mix any kind of food that your kid likes or you like. And then make small ice creams or lollipops and then give it to the kid. This is also a good summer treat to keep their body temperature down. And these are also used as teethers. Rather than giving them silicone teethers, give them something like this. When you give them something cold made up of yogurt, it helps their gums open up really fast and they have lesser teething pains. And next one is curd sattu lassi. Sattu is a very good source of proteins as well as all the 18 amino acids that are present. 2 more we are getting it from the source of curd. So you mix it and you give it to kids. It is a complete source of pre and probiotics again. And this is a service, this is a e-clinic. And this is how one's plate should look like, be it a kid or an adult. Thank you for your patience.
Thank you.
Thank you so much for the information. So let's bring alignment back to our body with a gentle chair yoga session inviting calm, flexibility and vata pacifying stillness. Allow each breath to become a mantra. So the session will be taken by our beloved Aparna Banji.
Okay. Okay.
Just keep it aside somewhere. my bag. Mike. नहीं announcement is done. This. Yeah, I think this should be enough. Yeah, little space in between, that will be good. Yeah, that's good enough. I'm not sure. I'll change according to the space. That can always be done. Check 1, 2. It's working. Oh, okay. Thank you. Okay, no worries. Yeah, no worries. That's fine. No, I had water. That's perfectly. It's okay if I remove the shoes, right? I feel comfortable doing yoga. I practice it. I don't wear shoes. Namaste everyone. Myself Aparna Bhatt. I'll be conducting a small yoga session on sitting on the chair, what best we can do, which you can even incorporate in your day-to-day while being in office or doing your work. It's very easy to incorporate few of the movements. So as we have mentioned already that this whole program is to incorporate the basic well-being, right? So if we are able to move our body in certain ways, not being moved from the place where it is a comfort zone for us or where we are sitting for 8 to 12 hours. So if we can incorporate those movements, at least we can delay or avoid also if you start early. Basic issues or whatever we are finding nowadays very common among the spinal issues what ma'am was talking about, right? So let's take care of our body, we'll take care of our joints with a small session. Let's begin the session on that note. Sit comfortably, sit with the spine straight, eyes closed, mouth closed. Bring your awareness towards your body parts. Feel the grounding of your feet on the floor. Feel the grounding of your sit bones on the mat or on the chair right now. Make sure you are able to feel both the sit bones grounded. As you sit comfortably with the grounding of the sit bones, mildly contract your pelvic floor. You'll feel a gentle lift in your spine. Maintain that length of your spine. Roll your shoulders away from the ears, shoulder blades falling towards your sit bones, making your shoulders relaxed. Hands are resting well onto your lap or on your thighs. Eyes closed, mouth is softly closed, neck is neutral. The whole crown part is resting tall. Once your body is well aligned, feel the flow of the breath. As your breath flows, observe the gentle movement in your belly area, chest area. As you exhale, feel the sensation the breath creates at your back muscles. Your navel goes mildly in, your chest settles back to the neutral. Take few breaths with that awareness. Gently join your hands together. We'll start the session with a round of Om chanting. If you are comfortable, you can chant along with me or you can just hear it out. Take a nice deep inhalation. Gently drop your chin down, look towards your palms, blink your eyes and open your eyes. Namaste. Let's start with the basic movements of our joint. We'll start with the neck movements. It's a very basic. Just be mindful if you have any kind of cervical issue, don't go deep into the neck movements. Hands can be in any rested position where you feel comfortable. Inhale, look up. Exhale, chin to the collarbone. Inhale, neck up. Exhale, chin to the collarbone. Inhale, neck up. Exhale, chin to the collarbone. Inhale, back to the center. Slowly look over your right shoulder. Stay there for a moment. Breathe. Let the breath flow. Nowhere we are holding the breath. Keeping your spine straight. Just look over your right shoulder. Inhale, back to the center. Look over your right shoulder. As you exhale, Inhale back to the center. Drop your right ear to the right shoulder. If you are comfortable, take your right hand, use it around the left side of your head and try to push it gently down towards the shoulder a little extra. You can hang the left hand down, create a little extra stretch in your neck muscles. Breathe. Inhale back to the center. Left ear to the left shoulder. Use your left hand. Press it further a little down. Let the breath flow. Drop your right shoulder down. You can always create that movement from the right shoulder to drop it down. Inhale, slowly release, gently back to the center. Slowly take your hands in front. We'll start with both the hands. I can't do both the hands. We'll do the gentle finger movements. Squeeze, release, squeeze, release, squeeze, release, squeeze, release. Squeeze, make a fist and do the wrist rotations. 1, 2, 3, 4, 5. Change of direction. 5, 4, 3, 2, 1. Press your palms. Imagine there is an imaginary wall with the heel of the palm, the base of the palm. Try to push it away. Feel that activation in your forearms. Breathe. 1, 2, 3, 4, 5. Turn it down. Push it away. Again, activate your heel of the palm to push it. 1, 2, 3, 4, 5. Gently release. Keep your hands either sideways or in front, wherever. Okay, keep it front only. We have space in front. Bend your elbows and straighten it. Let's activate the elbow joint. Bend it, straighten it. Bend it, straighten it. Bend it, bring it here and get into a nice shoulder rotations over there. 1, inhale up, exhale, take it back and down. Feel that shoulder blades working for you. 3, 4, 5. Change of direction from down to up. 1, 2, 3, 4, 5. Slowly release. Let's get into a gentle side stretch. So you can join your hands over your head, both the hands up. Lengthen yourself. Lean towards your right side. Breathe. 1, 2, 3, 4, 5. Inhale center. Exhale to the other side. 1, 2, 3. Keep breathing. 4, 5. Inhale back to the center. Slowly release your hands. Let the hands be beside you on your knees. Let's add a twist. Take your left hand outside the right knee. Rotate yourself. Look over your right shoulder. You can keep your right hand on the headrest of the chair. Breathe. 1, 2. Good. 3, 4, 5. Inhale center. Exhale. Rotate. With every inhalation, lift your spine. With every exhalation, your belly goes in. You can twist a little more deeper. Count every breath. Inhale, lengthen. Exhale, rotate. Inhale, lengthen. Exhale and rotate. Inhale, slowly come back to the center. Awesome. These are the basic movements for the upper body. Let's see what our legs has to say to us. Hope everybody has a space to straighten. Extend the knees. Yes. Okay, we'll do both the legs if comfortable. We'll make it a little quicker. Make both the legs straighter and down. Inhale, straighten. Exhale and down. Inhale, straighten. Exhale and down. Inhale, straighten and hold it. Push the palm feet away from you. Lengthen your spine. Keep yourself tall. Feel that nice activation of your calf muscles as you push the heel away, toes towards you. I know wearing the shoes, you don't feel much, but without the shoes, you can feel much more. Slowly with control, gently release. Awesome. Let's see what our ankle has to say. Can with the shoes ankle rotation be done? Then let's try it out. Rotate your right ankle, one ankle at a time, clockwise. All these joint movements helps us, I think everybody knows, the flow of the energy, flow of the prana, or the flow of the breath, if you talk about science. Change of direction. Release and relax this leg. Change of leg. Take your left leg up. Rotate it clockwise at your own pace. Change of direction. Other side. Awesome. Slowly release. One very important joint, we have a hip joint, right? Which is really taking a toll because of the sitting hours. So let's activate our hip joint. So we'll place our right ankle on top of left knee. If you are comfortable, flex your foot completely, pointed. Lengthen your spine. If you are feeling good, try to fold forward as much as your body allows. You can reach the floor with your hands, or you can just keep your hands on your shin and try to fold as much. Feel that activation. Aha, there is a smile on the people's face. That makes all the difference. Oh, yes. Okay. Inhale, slowly come back. Exhale. So here, when we do this, our target is you should be little sitting at the edge and focus on pushing the thigh, base of the thigh down, not the knee. Knee should not feel any kind of activation here. Just see if you can reach. You can keep your fingers here and see if you can press your fingers there. That's all what we are trying to activate, that hip muscle. Breathe. Now try to lengthen your spine, try to bring your chest to the shin and go deeper. Take few deep breaths over here. Inhale, slowly come back. Exhale and gently release the leg. Change of leg, left ankle on top of right knee. Lengthen your spine, flex your foot nicely. Extend yourself. Again, you can, if you are not able to understand, you can always place the fingers. Focus on just pressing the fingers with the base of the thigh. Extend, fold. Extend and fold. In the end, you can drop your hands, drop your head, go completely fold, and breathe over there. Inhale, slowly come back. Exhale and gently release, gently let go. Awesome. This is the very basic movements which we generally incorporate. One is a basic, another thing is our spinal movement, right? We all know this cat and cow movement. Let's incorporate that. You can always keep your hands either at the handle of the chair or on your knees. You can choose whatever works for you. I think I'm audible enough? Yeah, okay. So I'll keep the mic aside for a moment. We'll keep our hands on our knees. Inhale, lift your chest up, keep the belly in. If you are very comfortable, drop your neck. Exhale, suck that belly in, round your back, tuck your tailbone, push your chest in, ribs in, drop your chin to the collarbone. Try to go step by step. Inhale, create an anterior tilt in your pelvis, belly ahead, but it pulled in, lift your chest up, neck up, drop your neck. Exhale, tuck your tailbone, pull that belly in, push your shoulder blades, push your ribs in, round your back and chin to the collarbone. Inhale up. Exhale and go down. Find every vertebrae of your spine as you try to go here. Inhale and up. Exhale and down. Last one. Inhale and up. Exhale and round your back. Tuck your tailbone. Push your shoulder blades. Breathe. Slowly release and gently come up. Awesome. Let's do some standing poses over here. That will be a little more fun. I think that much we all can do. Slowly come up to the standing. You can always take a support of the chair if needed. It's not necessary that we need to always sit on the chair. It can be an passive support for us. We'll do a tree pose or the Vrikshasana. So you can take your right toe pointing outward, create that activation from the hip, nothing for the knee. Turn the right leg out 90 degree. Take your right heel towards the opposite groin. If it is not reaching here, you can keep it on the calf. Nothing for the knee. You can just keep it on the calf or on the thigh. Stay here. If you are comfortable, good. Join your hands in Namaste or over your head. You can choose whatever works for you. If you feel balance is a challenge, chair is there to support you. Breathe. 1, 2, let the breath flow. 3, 4, nice. 5, with control, release the hand. Gently release the leg. Change of leg. Turn the left leg out. Bring your left heel towards the right groin. It's okay if those who are wearing shoes and don't want to remove can keep it on the ankle. That's good enough. Raise your arms up. Join your palms together. Let the breath flow long and smooth. 1, good. You can keep it on the calf, not on the knee. 2, 3, 4, 5. Exhale and slowly release. Gently let go. Release it. Another very important posture to take care of our thighs is the chair pose. So we all will try imaginary chair. Don't feel actual chair. Hands up, join your palms, push your hips back and try to sit in a chair. No arching of the back, keep your spine straight. If feet together is challenging, keep it parallel. Breathe. Actual sitting is not allowed. Extend your arms and slowly inhale and come back. Exhale and slowly release. That looks beautiful for everybody. Awesome, that's nice. Sit back for a moment, breathe for a while, catch up with your breath. If you felt anything, though it's a very basic movements. Okay, let's spread our legs wide. Let's do some hip opening postures. Turn the toes outward. Right to the right, left to the left. That itself create a nice activation in our adductors or the inner thighs. Inhale, raise your arms up, lift yourself tall. Extend yourself, breathe for a while. 1, 2, 3, 4, 5. Exhale and slowly release. Just turn your toes front. If you are comfortable, extend your legs, knees straight, fold forward. Make sure the chair don't slip back. Just go easy. You can bend your elbows and try to go deeper. Breathe for a while. 1, 2, 3, 4. If you have a back issue, forward fold should be avoided. 5. Inhale, slowly come back. Exhale and gently bring both the legs together for Samasthiti. Awesome. Keep your left leg as it is. Extend your right leg sideways. If not straight, you can keep the heel down and toes up. Spread your arms wide. Exhale and go down towards the right side. It's a beautiful Trikonasana variation for the chair. Breathe. Stay static. 1, 2, 3. In line with the leg. 4. Yes. 5. Inhale, slowly come back. Change of leg. Right leg in the center. Left leg extended. Spread your arms wide. Exhale and go down in line with your left leg. Good. Breathe. Feel that opening in your shoulder blades, opening in your chest area. Try to breathe strongly over there. 3, 4, 5. Inhale, slowly come back. Exhale and gently release. We'll do a basic shoulder mobility also, because that is another thing which needs to be taken care when you're sitting for the long hours and creating a basic posture which has become a new normal and which we have to avoid. So take your hands in front, lengthen them. Inhale, open your arms. Okay. Exhale and together. Don't hit each other, please. Inhale, arms wide. Exhale and together. Inhale, arms wide. Exhale and together. Last one. Inhale, arms wide. Stay there. Feel your shoulder blades and try to flatten your arms without hitting each other. 1, 2, 3, 4, 5. Slowly bring the hands together. Interlock your hands beside your chest. Inhale, turn your palms, lift your arms up, look towards your fingers. Extend yourself, suck that belly in, create your spine long. 1, 2, 3, 4, 5. Just release the neck and lean towards your right side. Make sure your left sit bone is grounded. It is not lifting as you are leaning towards the right side. Breathe over there. Inhale, center. Exhale to the other side and breathe. Stay static. Feel it, stay there. Feel and try to breathe into your right ribs. Inhale back to the center. Exhale, release your hands. Interlock them behind. Lift your chest up and fold forward. Roll your shoulders towards the ceiling as much as your arms can go higher. That will tell you your shoulder. See, where are your shoulders? Where are your arms? They're not coming off the hips only. Inhale back to the center. Exhale and slowly release. It is an assessment for yourself, not for me. I'm just enjoying making you move in different directions. Hope you are enjoying it too. Okay. Another one shoulder mobility which is must and should everybody do during a desk job is using a table or a chair, whatever you have with you. You can always keep a chair or keep your hands on the table. And here we are not focusing on your lower back. Keep your tailbone tucked in. Try to just push your chest down. We are not doing this. We are just trying to push the chest down to activate our shoulders. Drop your neck, drop your head down, and stay here for at least 30 seconds. Give yourself a break. Push the palms, round your back, lengthen your armpit area, the outer part, the serratus, and then come back. We'll do few rounds of this. Can we make space to do this? Because I feel this is one posture everybody who is sitting and keeping their head down should do it. It's a game changer for a lot of my students who are practicing this. Hope everybody is able to find space. Make sure the chair doesn't slip. So just hold it and hang your head down. You can keep your knees soft. You can keep your knees soft and just try to push the head down. Breathe. 1, 2, 3, straight elbows. 4, 5, 6, 7, and 8. A minor change now. Just imagine you're pushing the palms into the chair and you're protracting your shoulder blades. Activate your outer armpit or serratus, whatever you understand with. Push it and push your shoulder blades up. Let's try. If you can understand, palms are pressing, shoulder blades are going up. Protract, protract, protract. No, protract. Chest in, protraction of your shoulder blades going up towards the ceiling. Feel those armpit area, outer armpit area getting activated. Awesome. Inhale and slowly come back. Exhale and gently release. Awesome. That feels good. Slowly sit back again. Relax yourself. On that note, we'll just do a closing calm down sequence or 1 or 2 postures to calm ourselves down and then get into a Shavasana. Keep your legs little wider. We'll drop both the knees to the right side and we'll drop both the knees to the left side. So you have to sit at the little edge of the mat, edge of the chair, so that you can create a gentle internal rotation from the back hip, back leg, and the external rotation from the front leg. 1, 2, 3, 4, 5, 6, 7, and the last one, 8. Inhale back to the center. Bring both the feet together. Push your knees apart. Feel that gentle opening in your groin area. Feel that opening in your inner thighs. Breathe. 1, 2, 3, 4, 5. Slowly bring your legs together. Hug your right knee to the chest. If you are comfortable, chin to the knee. Pavan Muktasana. Breathe. 1, 2, 3, 4, 5. Slowly release. Change of leg. Left knee to the chest, chin to the knee. 1, 2, 3, 4, 5. Inhale, slowly release. Gently sit back comfortably onto the chair. You can lean your back onto the chair. Relax your hands on your knees. Make your eyes close. You can extend your leg if you feel comfortable or you want a bend knee position. Eyes closed, mouth closed. Let the breath flow through each part of your body. Try to move little inward into your body. Feel that activation of various joints, gentle movement of various areas. A very delicate, your ankle joint got some movement. The knee joint, which needs its own set of work. The hip joint, overused, need to be taken care. Not regularly, I mean daily. That makes the difference in your hip joint. Relax your back muscles on the backrest of the chair. Let your shoulder blades go and touch the backrest of the chair. Hands are resting well onto your thighs. Palms are in chin mudra if you are comfortable doing so. Index finger and the thumb touching the tip to each other. Eyes be softly closed, mouth be softly closed. Feel a flow of the breath from your crown till your toes. Have a single thought with every inhalation. The breath is flowing through each part of the body, making me really relaxed and released. My legs are completely relaxed, being in the position they want to be. My arms are resting well. My frontal body, the chest area, the belly area, is well supported by my back muscles, which are getting a good support with the back of the chair. Head is relaxed. Let's move from the body to the breath. Bring your awareness towards your navel. As you inhale, feel that gentle lift in your navel. As you exhale, let it go. Let it sink into your spine. We'll try to do a few rounds of deep breathing so that if there is any miscorrection in our breathing, we can correct it here in the Shavasana because every body part is in its natural state. Bring your awareness towards your abdominal area. Take a nice deep inhalation. Expand your belly like a balloon. Exhale it completely. Once exhalation is completed, pull your belly into your spine and let your spine rest into the chair or the mat. Inhale deeply. Expand every part of your abdominal area. Exhale completely. And pull your belly into your spine. Inhale deeply. Exhale completely. Try to repeat 3 more times at your own pace. It's a very beautiful practice to activate our abdominal organs. It's a very beautiful practice to keep out the stress from your mind because your mind is focusing somewhere else. It helps us to release and relax various kind of discomfort from your spine also. Slowly relax, do normal breathing for a while, making sure that inhalation moves our belly little outward and exhalation settles the belly to the neutral. Let's bring our awareness towards our mind. Observe that how beautifully as our focus goes onto our breath and our body, the mind has minimal thoughts passing by. So make sure during the working hours, in between, move your awareness towards your breath and see how you are breathing. Just create 3 to 5 deep breathings in between. After every few hours, couple of hours, if you do so, you can see that you can really avoid any kind of physical discomfort which is coming due to stress or too much of overthinking. Try to avoid responding to any thoughts passing by through your head right now. They are like visitors in the house. They keep knocking the door. If you don't open them, they have to go. So try not to respond to your thoughts passing by right now. If your mind wanders, bring it back to your breath. Feel the flow of the breath. You can bring your awareness towards your heart center, trying to listen to your own heartbeat. It's not easy to listen to your heartbeat. It needs immense amount of focus. Lot of mental inwardness. Let's for 30 seconds to a minute try to focus onto your heart center and listen to your own heartbeat. Gently bring your awareness back to your body. Wiggle your fingers, wiggle your toes. Or if you're wearing the shoes, wiggle your ankles. Gently bring both the legs together. Hands over your head. Interlock your fingers. Give yourself a nice long stretch from your fingertips to the toes. Exhale and slowly release your arms. Join your hands together at the center of your heart. Let's close the session with a round of Om chanting. Take a nice deep inhalation. Gently rub your palms together. Generate some heat in your palms. Softly cup your eyes with your palms. Don't press your eyelids or eyebrows. Just cup them. Feel that warmth of your palms around your eyes. Blink your eyes. Gentle massage your face with a big, big smile. Chin down. Look towards your palms. Thank you, everyone. Hope you enjoyed it. Go. Go. To 145 every.
So let's enjoy a sattvic lunch. Fresh, local, seasonal, and digestively harmonious. Food, after all, is aushadha. So when eaten with mindfulness, so I request all of you to please go and have your lunch, ma'am. We'll be right back. Yes, we'll be back by 1:45, and then we'll have the panel discussion. Okay.
Again, good evening, everyone.
Good evening.
So we will just proceed with our session that prevention to intervention is today's our topic, and we need to understand with each and everyone that how we are building this metaverse of integrative health and wellness, right? So in this form, I will just asking some simple, very simple questions, but want to bring the awareness that what is the real meaning of this collaboration and what when we say integrative, right? So how this integrative means, is it parallelly doing the ayurveda medicine or the homeopathy medicine or naturopathy with the modern medicine, or is it finding out the ways that where, when and how these both should be collaborated, or if not required, how to make this understand to the wellness seeker, right? Okay, so in this category, Dr. Josna, my question first is with you that we most of the time we say that uh, symptoms are treated, not the person,
Exactly.
right? Okay, so what is your experience when you have treated some chronic ailment? Have you ever experienced that when you have treated the physical symptom, at the same time the person is healed emotionally and spiritually by the soul also?
Absolutely. Thank you so much for this wonderful question, Dr. Priyanka. So, what we say, treating the symptom does not really treat a disease or a disorder. A symptom is just something that the body shows that there is something internal, and that is the one which has to be treated. And naturopathy philosophy is all rooted in treating the root cause and not the symptom. For example, someone has a fever. It indicates that there is either an infection, inflammation, something that is wrong in the body, and fever is just a symptom. Just by treating fever or taking care of the fever, we may not be able to go to the root cause of it. And similarly, suppose someone is complaining about some aches and pains. There is numbness and tingling in the fingers or in the feet. That is just a symptom. It could be, the cause could be a diabetic neuropathy. It could be, if it is in the fingers of the arms, it could be because of cervical spondylosis.
Yeah.
If there's a pain in the back or in the leg, it could be, that is just a symptom which body is indicating and telling that there is something inside that needs to be taken care. So we go to the root cause and analyze that and treat that root cause in a holistic way.
Superb. So, doctor, like as you said that if suppose you have healed somebody's back pain,
Yes.
right? Okay. So, do you agree with that by resolving that back pain, the productivity of that person has increased, and the emotional quotient, which might be the frustration after going home to the kids or to the family which was coming, has reduced?
Absolutely, Dr. Priyanka. Recently, we have treated a case. Someone in a group, they went to a trip to Bangkok and they went for a deep sea diving. And by the time that person, he was moderately obese. And then by the time he came up, he had severe back pain, completely in tears, crying. And they were in Bangkok, not knowing what to do. They went to the hospital and then spent about half a day on that, in that hospital, but nothing worked out. Maybe some kind of some symptomatic pain, but the pain continued, very severe. They took 2 days to come back, and this person was in Khammam. After they went back, it took about 15 days for them to undergo some kind of a medication, but the pain did not subside. And then he came in such a state that my life is ruined, emotionally devastated.
Yeah.
There is nothing for me to look forward to in such pain. And that is when he was referred by one of the person known to us, and then they know what we do. And he came and he took the treatment 4 days, and then he was completely out of pain, at least by 60%.
Superb.
He was not in a position to sit for 10 minutes, or even while coming into the clinic, he was not in a position to walk. So that kind of definitely an emotional stability, or even when they are in that state of mind where the pain completely reduces, they obviously have that kind of a spiritual and emotional benefit.
Superb. And that's what WHO says.
Yes.
It's not only the physical wellness, right?
According to WHO, the definition of health is a complete, it's not just the absence of disease or infirmity, a state of well-being in all planes of being, physical, mental, moral, spiritual, and emotional.
Absolutely. Superb. Thank you, Dr. Jyotsna.
Thank you, Dr.
For the
Priyanka.
beautiful answer. Yeah. So my next question is for you, Dr. Ambika. So are we unknowingly setting kids up for chronic disease? You mentioned the small part in your session also. So I have picked from that, right?
Yes, please.
Okay. And that what the most underestimated habit what we are giving to the kids today, which is taking them in the later stage to the chronic diseases.
Okay. One thing that first thing is a very good question.
Thank you.
That what is the one thing we are underestimating and taking the kids to the chronic diseases? Our own mentality.
Oh,
Yes.
okay.
My kid doesn't eat this. Let me make something else. Let me make something tastier.
Okay.
My kid loves paneer. Let me give only paneer to the kid.
Oh.
You know, his father also was like this. He loved only sweets. He also will like only sweets. Let us give him sweets only.
So it is a kind of over pampering.
Yes, it's a kind of over pampering, and most importantly, parents these days don't understand one thing, that
But
every
we all
kid,
do, right?
yes. So
Yeah.
every individual has their own taste buds, has their own preference, and has their own likings also. But somewhere we are setting it up. We should understand that, let them take their own decision. And one more thing that is ruining everything is expectations of parents. In a way, like a lot of parents come to me and they say that my kid doesn't eat anything. Height is good, weight is good, the kid is active, the kid is sleeping well,
How is it
emotionally very
possible?
well settled. Then even if the kid is eating less, maybe the kid, like requires only so much of food.
Makes sense.
We should let them make those decisions, not when they're like 8, 10 or 15-year-old, when everything is out of your hand. Let that start right from day one. A kid 3 days old can also reject breast milk when they're full.
Okay.
A 6-month-old kid will start, like rejecting food once they're full. What do? We start distracting them. Kawe ko dekho, kabutar ko dekho,
I
khana
have done
kha
a
lo.
lot.
So that is how association is going on. The association is no good association with food.
Oh.
Everybody has to have a positive association with food. Why do we say that school food is bad or outside food is bad and home cooked food is good? When a mom cooks, she is only thinking, my kid has to love this food. He has to heal with this food. He has to grow well with this food. Same way, when we are eating food, if we associate it positively, then a right bonding happens. The digestion also takes place well. They say that when you're cooking, whatever you're thinking, that gets passed into it. Same way when you're eating, okay, whatever you're watching or whatever you're thinking gets passed on to it. Recently there is a study where they say that when like you're exposed to screen while eating food, the glycemic load is higher than the glycemic index. Glycemic index is same, but the sugar levels are staying higher for a very long time. Same thing happens with the kids as well. So we are eventually like putting them onto diabetes or obesity or kidney disease. I am seeing a lot of kidney issue kids these days who are 5 and 8 and 10-year-old. So all this is onset of the problems that has started from the kitchen.
Absolutely. This is very insightful. And Dr. Harsh, would you like to add to this part?
Brilliantly said by Dr. Ambika. So the part where she said that there's a food association, the screen part specifically. So there is a very abnormal flux of cortisol hormones when a visual trigger is there in front of a kid when the food is being fed. And that flux of this cortisol is what causes a sustained rise of glycemic load, and rather the sugars being on the higher side. The same food which should digest in, say, let's take 20 minutes takes much absurdly uneven time. And then that leads to a very abnormal absorption of carbohydrates, and a malabsorption of carbohydrate is also a problem. Just like an overabsorption or an underabsorption. So all these issues are interlinked. So I think that's very true.
No, this is, and I would like to really add you have given the scientific part of this. In Ayurveda, it is already mentioned that whenever we have the food, right? Okay. So in that one, always the carbs, the mind is not with that. Okay. So that what was going to be, it will quickly go down. So you are getting the spike and again you are getting hungry, which will come as a fake hunger. So perfect. I will move to Dr. Nisha. Yeah, Dr. Nisha. So, Dr. Nisha, what are the most promising real-world outcomes you have seen from the stem cell therapy in conditions such as autism or any other where we still don't have much other care systems?
Okay, so stem cell therapy is a very new and innovative therapy. It has recently started in India. So we come into play when there is no treatment for a particular disease. Say your liver, kidney, you are seeing an increase in creatinine or your liver enzymes, and there's nothing much you can do about it. Say your doctor tells you to follow a diet, change your lifestyle, and still you see the increase in the levels. So then, as an intervention, you can opt stem cell therapy. Stem cells, what we do is we play with cells. We regenerate your organs. We arrest the disease at the stage it is, or we try to reverse it. That's what we do with stem cell therapy. And right now we are seeing a high increase of autism cases. Don't know why. It can be due to social causes or stress during pregnancy, as we identify to be the #1 cause for autism. So we are seeing some gut neuronal good integration with stem cells. And it is basically due to inactive neuronal clusters. And when we give these cells, they activate the neuronal clusters in the brain. They decrease the inflammation in the gut. And so we see a lot of cognitive improvements in autistic patients. And overall behavior also improves. So there's a lot of scope for stem cell therapy in diseases where there's no treatment. And we have a lot of diseases for which we still don't have good and effective treatment.
And Dr. Nisha, how much like kind of time it takes if suppose, or and is it there any duration, right duration of also where the autistic parent kid parent should reach you? For example, the early diagnostics comes by mostly 1.5 years where parents
Early
start realizing.
intervention, it's diagnosed at 2.5 years. Below 2.5 years, they don't diagnose it.
It is
So
kind
they
of
still identify some delayed milestones, but conclusive diagnosis is not given below 2.5 years. And we can treat the kids below 13 years.
okay.
Above 13 years, it's very hard to treat the kids with cells because of a characteristic called neuroplasticity. So because of that, we see significant results in kids below 13 years of age with cell therapy.
Got it. And the prognosis is same from the 2.5 year to 13 years.
The prognosis is same. So we give 3 doses, which are minimum for each autistic kid, with a gap of 3 weeks in between 2 doses. So we complete this therapy in 6 weeks of time. And from there on, after the first session only, you will be noticing changes. A hyperactive kid sleeps. He sleeps for 8 hours, which is a boon to the parents. Because in all this drama, I think the parents are the one who suffers, you know.
Victims,
They can't be awake with the kid,
Actually.
going out, doing their job, and coming back and still taking care of the kid 24 hours. Because an autistic kid sleeps only for 2 hours. And he's very powerful. He's very energetic, even though he sleeps for 2 hours. So it's tough for the parents to manage. And I would say this is a boon for the parents.
So just out of interest, one more question.
Sure,
like, so some kids are kind of diagnosed partially autistic. So should I mean they are not autistic but only
autism is a-
hyperactive.
Yeah. So
right?
ASD is autistic spectrum disorder. The kids can fall anywhere on the spectrum. They can be mild, moderate, or severe. We have an ATIC score which we take into consider, and depending on the ATIC score, we treat the kid.
Super. Yeah. Thank you. Thank you. Yeah, so very insightful, Dr. Nisha. So I will move to Mr. Ram Kiran Kumar. Yeah, so hi. So my question to you is that you, in your work where you are digitalizing all the medical data of regarding the patient records and all, what tangible shifts in efficiency have you observed in the hospital workflows or doctor-patient interaction, and where is the real ROI for the healthcare systems with this digitalization?
Okay, that's a three-part question. I'll go one by one.
Absolutely.
Firstly, the changes in hospital workflow. One thing is you talked about integrating different hospital practices. We are able to integrate different parts of a hospital. So, for example, a pharmacy, the doctors of different departments, the labs, they do X-rays, any other procedures that they do, surgeries, we are able to integrate all of them, make it so that all the information is very easily exchanged between all
for the
members of the hospital.
multidisciplinary system.
Yeah.
Perfect.
It's very convenient and it reduces the amount of time needed. And that is a very simple version of it. If you go into more detail, you get much more specific things that make life easier for the patient, make life easier for an elderly person who has to keep repeatedly coming to a hospital. And that also goes into the second question of patient-doctor interactions. One of the ways that it has changed is we have very clear medical histories, especially if you use a hospital software, specifically for hospitals, if you use it, you have very clear histories, especially for conditions that need patients to repeatedly come to the hospital. You're able to know exactly the day that they came, what prescriptions, what procedures were performed. Everything is very clear, and you don't need to depend on the patient. And it's comparatively harder for the patient as well if they need to depend on themselves to recollect all of this and then tell it to the doctor. Having it with them makes it much easier. And not only that, we're able to completely send everything to the patient. That makes the amount that you need to carry around also reduce. And what was the third?
So the second part is that how we will understand the ROI of the healthcare system in this part.
ROI, usually, I'll talk about this from our software's perspective. Usually, the two reasons that I told previously are enough for most hospitals to understand where there's a where they can benefit from it. And not only that, there are countless other ones where we go into it. But if we're talking just monetarily, one, there's a reduction in the number of personnel you need.
Okay.
There's a lot that goes into managing a hospital for which you usually need a lot of people. A lot of this work is taken care of by the software.
So the manpower cost is
that
reducing.
reduces a lot. And not only that, if someone leaves the hospital, if someone in the staff leaves, then you're very easily able to train them to just use this software. And those tend to be like the very basic, directly monetarily beneficial things.
Understand. Yeah. No, very valid because Take your time. So we will continue. So I would love. We completely practice in system, so we create the prescription, we have all the datas of the clients, right? Okay, so till date how many clients we have practiced, so each and every person's data and the multidisciplinary system, we have 5 experts in the system working together each and every time. The specialist, suppose it is a diabetes issue, right? So Dr. Hirsch will be the diabetologist, then the person holistic doctor like me, then dietitian, then yoga trainer, then psychologist, right? So these all experts are working in a system together and they have the access of all the data the same time, right? Okay. And nobody use any paper because all the information flows in the system, and the sessions can happen in the hybrid mode, offline or online, but the data will be all in the system, right?
Yes.
So further to that, where we are struggling and we will need your more help, we all doctors, that till now the EHR what we are experiencing, it is mostly a repository where we are able to see the reports, but we would need the analytics also, so that the progress report from the beginning, the patients come with us with the long final sheets, right?
Okay.
Right? Multiple, like, because in chronic disease and all, it is more severe, right? People come with the 10, 15 years histories, and it takes lot of time for us still to go through that reports. So if you can help us with the progressive report and the comparative report, that analytical data, it would be great for us.
I think we should have something like that.
Yes.
We already have a system that is somewhat like what you said. I think if we discuss it, we can probably exactly find out what your exact situation might be and change whatever might be needed to use software for that situation as well. And usually the thing about software is it depends on the problem. If we don't know a problem, we just have to know about it and we're able to solve it.
Yes, exactly.
So as long as we know, it's good enough.
Yeah.
We have,
so you need to interact with us more.
Yes. Usually we've had people every month come up to us, talk, this is a new problem, we're able to solve it within a week.
Yeah.
And
So
they're happy about it.
that's awesome. That's awesome. But I mean, thanks for bringing this facility, because this has resolved our literally not only the manpower issues, but we are more precision now in our decisions when we are approaching the clients, because sometimes we ourselves were used to miss the reports. Yeah.
Makes it very easy.
Yeah, thank you, Jay. So my next one is Dr. Nitish, audiologist. Yeah, so doctor, is silent suffering the new norm?
No, not really.
Okay, with rising headphone use, how close are we to a hearing epidemic, and what signals are we ignoring until it's too late?
So, we are actually not close to any epidemic again. So
thanks for ensuring.
Yeah, but the point is, the statistics say that by 2050, the number of people with hearing loss would increase to about 900 million. And right now it is about 470 million-ish.
Oh my
okay, so
this is alarming.
So that's pretty alarming. now we have to think, what are we really ignoring? Okay. It always starts inside the womb. So when the baby is inside the womb, it's important the person who is carrying the baby is supposed to be careful. So it is not only the mother who is responsible, but the spouse, the spouse's parents, the spouse's siblings, and also the mother's family members. Because
So
in
all the
Indian
family
culture, if you see,
members.
usually the mother is in the in-laws' place. So basically, everyone in the house should be responsible for
Well
the
said.
person carrying and the baby itself. Okay. Now, what should they be responsible about? Okay. The stress, mental stress, physical stress. These are the two things that they
Absolutely.
need to take care of.
Yeah.
That's it. Okay. Physical health, there are so many branches to it. Nutrition, there is that, blah, 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 everything. Mental health, again, are you doing, are you relaxed? Are you happy? Are you satisfied? Bliss?
Yeah.
That's it.
Well
That's all
said.
is necessary. Now, other than this, the few people who think that if the mother goes to a movie and get exposed to that loads of noise,
Yeah,
sound, and
yeah.
everything, then they are happy. The child also would be like Bahubali.
Is it really so?
That's how their
I
expectation
never
is.
know that time.
That's how people's expectation is. That's not right.
Oh.
The mother is not supposed to get exposed to noise pollution as well. Okay, loud
Makes sense.
sounds can also lead to fetal hearing loss. Okay, so nowadays there is that trend that parents, the mother mother in the sense, the carrying
Yeah.
mother is going to the theater
So you
and wants
included
to
the
enjoy
surrogates
movies.
also.
There are a few people who are very casual about smoking. There are a few people who are casual about having alcoholic drinks or aerated drinks like Coke and stuff. Coffee अच्छा लगता है. I want to consume coffee. I want to be active. Wrong. All these things indirectly affect the baby because baby is sharing the food that you take. Okay, that is one part, which is being the primary cause of many issues. Hearing loss could be one. Autism could be one. Many other issues are also there. Heart issues हो सकते हैं. Okay, बहुत सारे issues हो सकते हैं. Kidney issues हो सकता है. Malnutrition हो सकता है. Lack of hydration in the body. So many things are
Agree.
there. Okay, it affects the child.
Yeah.
So that is first place they should stop. Secondly, if it is a kid or a younger one who is exposed to headphones, as you asked, headphones are being too loud. They can be as loud as 120 decibels as well.
Oh.
Okay. So on an average, research tells that the headphone usage is somewhere about 85 to 90 decibels to enjoy the music. Bam, 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 bam.
Highest one.
Not the highest one. They like to set the headphone to that level.
Okay.
But WHO tells 85 decibels for 8 hours leads to permanent hearing loss.
Oh my God. I think this awareness is
5 decibels ऊपर
required.
जाता है, 85 से 90 को अगर जाता है, that 8 hours comes to 4 hours. It is that risky. So therefore, 60% volume, 60 decibels is a good place to stop. And वो level अच्छा होता है, कान को भी rest चाहिए होता है and all. So it is important that you monitor your child. You can get headphones which limit their output to about 85 decibels or so. So that is one thing what we need to be careful about when it comes to headphones.
super.
Next thing, epidemic जो आप बोल रहे थे, on that front I would say that there are many children these days ठीक से पढ़ाई नहीं करते हैं, ठीक से सुनते नहीं हैं क्लास में. Okay, parents complain about their children often कि ऐसा है, मुझे लगता है कि कुछ ये है क्या नहीं. It doesn't strike in your mind कि it is because of hearing loss. It is because maybe मेरा बच्चा वैसा है. मैं भी पढ़ाई नहीं कर रहा था तो मेरा बच्चा क्यों करेगा? These are different silly thoughts that we have
Or
in our
maybe
mind.
to consider that kid autistic due to the
No, it is, see, autism is a different thing altogether. It's
no,
a
this term is used like I mean
nowadays people are using
it's
it.
misnomer.
I
Yeah.
come across patients
Yeah.
for speech therapy when it comes to autistic. So people really doubt autism, and I see many healthcare physicians specifically saying that your child is autistic at about 1.5, 1 year old. 1 year old, how can you really
How can you diagnose?
you really say that the child is autistic? So
Absolutely.
it is not about that. You need to correct yourself first and then think about the child. Child is in the growing phase, and the mind is really the plasticity is so fresh, okay, until first 5 years of age.
Yes.
And the child keeps learning. He'll
Yes.
learn language faster than what we can.
Yeah.
Okay, so that first 8 years is very crucial. 5 years are even more crucial. So therefore, we have to really see and observe the child very carefully. What are we exposing the child to? What we want the child to be exposed to, and everything. What mistakes have we done, and what the child shouldn't do? What mistakes are others doing, and we should not do the same. जो भी है, all these things we have to observe well. And epidemic के बारे में जो बोल रहा हूँ, I think parents should understand this fact that if there is some lacunae, if they feel that their child is behind or lagging anywhere, it could be because of hearing loss also. Because if today, if I'm sitting here, or if any one of us is sitting here and is listening or trying to understand, it is
Yes.
because of hearing.
Yes.
Whatever
Yes.
we have learned is because of hearing, because of visualizing. It is because of our senses.
Yes.
Senses play a very important role, and for communication, hearing is the most important.
Absolutely.
I hope that answers.
No, yeah. I mean, I was yet to ask the proactive steps to be taken by the families, and you have already covered that. So my so very pro. So my one question is that these days the expecting females are wearing the shields, right? For the to protect from the sound and to protect from the screen. Okay, so does that work really?
What shield?
So it is like they wear a shield over.
No, they are trying to
Just-
get away from some radiation, I would say.
It is only for the radiation, but
no,
it is
no.
not helping for the
So,
hearing part.
There are two types of radiations. One is what our mobile phones and all these emit, like 2.4 gigahertz का जो cordless phones होते हैं,
Yes.
mobile phones होते हैं, क्या नहीं. These radiations are not as strong as X-rays, CTs, and all. So, but still, these radiations for a longer term are risky. You can see mothers putting their mobile
Yes.
phone like this.
Yes.
Resting.
It is a resting table.
Yeah. There are few people who have seen, who have also put headphones like this. And the bhajago words.
Yeah.
So one has to be careful. Okay, one has to be practical. Okay, seeing some photos or some, they are particularly models, I would say. Okay, they might do it for a certain purpose.
Yeah.
Maybe it would be a business commercial or whatever, or somebody promoting their organization or whatever. But doesn't mean that has to be imitated right like that.
Yes.
Okay, that's wrong.
Yes.
Okay, please don't do all those things. Radiations are not good. Mobile phone usage has to go down. Wi-Fi से थोड़ा दूर रहना चाहिए. Anyway, you will not put Wi-Fi beside you, but Wi-Fi, mobile phone usage and everything has to be down specifically for a pregnant female. Or pregnant female बैठे हैं and the husband is scrolling. That's also
That is
wrong.
also impacting. Yeah.
So you have to be conscious of
Very
what do you
valid.
do.
Yeah. Thanks for these all. I think this is going to make future because we have done already the damage what could be done. So here like in Ayurveda we call the senses indriya and the ati yog, the excessive use, whether it is in the intensity or the frequency or the duration. So that all is considered as the major reason for all the diseases. So I think what we are going for, that the technology, in the form of technology, we are getting slave of technology rather than technology being our slave.
Yeah.
So that what we need to change, right? Perfect. Sure. Thank you, Doctor.
Thank you so much.
Thank you. So I will move to Dr. Ajay Lahoti. So Dr. Ajay, you say smiles are linked to lifespan.
They are.
Huh?
They are.
Perfect. Okay. And I definitely agree with that. What's the one dental myth that's doing more than harm than skipping a checkup? And I will proceed to the next one.
I think the first and the most important dental myth that people have is that I'll go to a dentist only when I have pain. No, once you have pain, the damage is already done. So you go to a dentist and you get a yearly checkup done or a biannual
Regular.
checkup done.
Yeah.
Actually, you can catch the problem in a nascent stage where the treatment itself would be very minimal. It would not be an invasive treatment. With minimal effort and minimal treatment and no pain, you would get healthy. Whereas, अपने पास, so most of the time we have an excuse. Time nahi hai yaar. I have to do this. I have to do this. I have to do this. So
Not
if you
the priority.
yes, it's not a priority. Dental is दांत है, कुछ नहीं होगा, दांत निकाल देंगे. You know, that's the notion that we have. But we have to understand one thing: anything and everything that you eat or drink goes through your oral cavity. If that is not healthy, you are not healthy. It's as simple as that. So
very well said.
If you don't have good oral health, you don't have good systemic health. Simple.
No, that's very true, doctor. But the irony is, it is not only with the you dentist, right? But it is with all the doctors. So the person comes with the pain only.
usually heart attack आता है तो डॉक्टर के पास चले जाता है.
Yeah.
दांत में जब दर्द आता है तो मेडिकल शॉप जाता है पहले. कुछ दिन मैनेज करेगा एंड देन उसके बाद फिर नहीं मैनेज हो रहा है यार, अब तो जाना ही पड़ेगा, फिर जाएगा वो.
Okay, sure. So, and how does oral health directly influence the systemic health? As you rightly said, everything goes from the oral health, right? And then tell us the preventions also.
So basically, if you see, and as I said before, that anything that you eat goes through the mouth. So whatever bacteria are there in the mouth, if your mouth is not going to be healthy, you're going to take it, ingest it, and it will pass throughout the system. So there are several studies that say that people who suffer from gum disease, they have a higher incidence of heart attacks, they have a higher incidence of lung infections, they have a higher incidence of even brain strokes as well. You know, there's a condition called endocarditis, which is usually caused because of bacteria in the gums.
Oh my God.
So yes, so valve replacement and people who are already on some cardiac procedures or cardiac medicines, they are highly susceptible, and that is one of the reasons why we tell that you always need to get a checkup done and take corrective measures at the initial stages, so that you don't end up being a victim of something like a heart attack or a stroke just because of the simple toothache.
Yes,
that can also cause that.
No, I mean, this is very insightful, and there I absolutely agree with you that most of the time we just ignore our oral health and keep going for the other, even the health part and the cosmetics parts, right? One time, one incident I remember in my family members only, one of the person was having high CRP. Okay, and this CRP and ESR both were not reducing, and then I told that first go for your dental checkup. I believe that there is some gingivitis, right, which might be not allowing, even if you are having all the medication cleansing processes also, and still it is not happening. And that when that person went to the dental checkup, it was there, it was treated, and after that CRP was also under control. So
we just treated a patient who was having edema in the feet, who had pleurisy of the lungs as well, who had severe systemic challenges. But the main culprit was just one infected tooth.
Oh my God.
The patient was diabetic, so the immunity is already shot out. and because of that one single tooth that she was not getting treated again and again and again, um, and then she ended up in a hospital, in and out of hospitals for almost 6 months, spent close to 10 lakhs just on hospital bill alone, but did not want to get a simple tooth removal done. That is what the irony is.
This is insane.
It is insane, absolutely. People believe that teeth are not important, but teeth are as important as
Heart, more than
or the
anything.
lungs.
Yeah,
Yes, they are.
definitely. Perfect. I mean, this of your experience, this is scary.
It is. It is.
Yeah, sure. So,
It is very scary. Getting an operation done is not that scary.
See, people believe that getting a tooth removal is scary because they don't know what to expect. In a hospital, in a operation, they know they're going to be knocked out, unconscious, so it doesn't matter. Whereas, yes, whereas when you're getting a tooth removed, only you get anesthesia for that jaw or for that particular tooth, and then you see all of those sharp instruments lying there, and then dentist wearing the gloves and mouth mask, and चार लोग खड़े होते हैं आमने सामने. So, but if you educate your patients well and you tell them what is going to happen next and what they should expect. So, I educate all my members, patients, saying that, give me one of your fingers, right? Hold on to that. See, you can feel that I'm holding on to this. So, you are going to experience that pressure. But majority of the time, what happens is the patient perceives that pressure as pain.
yeah.
And that is where the actual problem is. You have to educate them and you have to tell them what to expect. If you don't tell them, the fear of the unknown is much, much worse than the fear of the known. That's what absolutely is the problem with dental procedures. You don't know what to expect, and that's why you're scared of them.
So, is it something like this scare is more in the females?
So,
Okay, you will
it's
not
not about females or males. It is about what you have experienced, maybe as a child, or maybe your first visit to a dentist itself was scary. So usually when we try to treat kids, right, we do not want them to be exposed to invasive procedures in the first procedure. The kid has just come to me and I take out a battery of instruments and I take out a syringe, poke him. He's not going to like it.
Yeah.
Obviously,
yeah.
nobody is going to like it. So that what you have to do is you have to inculcate, you have to create a bond between the child and the doctor, saying that hi, how are you? Get to know him better, get to know her better, and then slowly you can ease them into procedures. So you can start with maybe basic cleaning, or maybe start with basic fillings before you proceed on directly to an extraction, or something that requires cutting a gum or giving an injection.
No, that
Because
makes
that's
really
scary.
sense. Yeah, yeah, definitely. So you are a friendly dentist. Yeah, absolutely.
Now, see, no dentist can claim that 100% pain nahi rahega karke. There will be a pain because
But
the patient themselves has come at the last
Yes.
minute, and they usually come with massive swellings or acute pain. So managing that requires a certain amount of nuance, yes,
Yes.
and it will take some time. So it's a two-way street. The patient also has to agree that there has been some delay from their end, and it is going to take some time, and obviously it is going to be slightly painful when the procedure is delayed.
Perfect. No, we all agree with that, doctor. And to prevent to come to you, what we should do?
Very simple. Brush twice, floss twice.
Floss
and
also twice. Oh my God.
Listen, you don't have to do a traditional flossing.
Okay.
Aajkal you get water flosser, which is very easy to use. You can use it in less than 60 seconds.
Oh.
Just flush out anything that is stuck in between your teeth. And main thing is rinse after anything and everything that you eat or drink.
Perfect.
So at least you're removing whatever particles are stuck around. And that's it.
Not
Simple.
allowing to clog.
Sorry?
Not allowing to clog.
Not allowing them to stick to your
yeah.
teeth. So especially in case of kids, what happens? We give them biscuits and chips, which actually crumble, get stuck everywhere. They remain in contact with the teeth for a long time, and that is why you have more cases of decay now than when say about 30, 40 years back, because we don't have access to chips or biscuits or
And
anything
chocolate.
chocolates as well. उस टाइम पे मिलती क्या थी, एक इक्लेयर, एक मेलेडी, एक बॉन, 3 तो थे. आज चले जाओ पूरी दुकान लग जाएगी. So it's like that. They have access and there is also availability as well.
Yes.
So that's one of the main reasons why 2-day is more now when compared to say about 30-40 years back.
And what are your thoughts on oil pooling?
You can do any. See, as I said, rinsing.
It is kind of a rinsing.
It's yes. आप rinsing में क्या कर रहे हो? You are making sure that you rinse your mouth and you remove anything that is stuck. Oil pulling में भी आप वही कर रहे हो. You can use essential oils as well. The Ayurvedic science and there's not been much research that has gone into the effects of all of this, and that is probably why there are a lot of myths surrounding that. And probably Dr. Jyotsna would be the correct person to answer questions about those things. But oil pulling is pretty good. Yes.
Yeah. Perfect. Sure.
Thanks.
Thank you, doctor.
Thank you.
So, Dr. Virender, why do most people start caring for their joints only after losing?
See, the basic understanding is we should know that all of our joints, like any other organ, is designed for life. Okay, so your heart, your lung, all of this is designed for life. But most of the people think that after 50, though, I'll get a pain. It is okay to get a pain.
Oh, it's okay to get a pain.
That is the that is the basic
perception.
myth. Yeah. So that is largely because they do not have an understanding that their knee also is supposed to function fully till they are alive.
Absolutely.
Okay. So the basic understanding is once they start getting pain, they realize, okay, this pain, I'm 30 plus, 40 plus, 45 plus. So they accept the pain and start living. That is not the way to do it. Most of us start getting pain post 30-35, largely because your aging has started in.
Now, so we are able to see in 12 to 13-year kids also, doctor. Obesity.
Yeah. So commonly our patients keep asking, like, what is the first red flag you see?
Yeah.
To understand whether you have a pain.
My next question was this only.
Yeah.
Thanks.
The first red flag is every day you see in your mirror, look at you. If you are obese, that is a red flag.
Oh.
Okay. So your body weight has to be carried by your joints, and any joint on either side is covered by a layer of cartilage. That is the one which wears off. Okay. The pressures which you get in your knee joints is roughly about 1 to 1.5 times of your body weight when you stand and walk. It will be roughly 3 times of your body weight if you take a stair. It will be about 4 to 6 times if you squat, sit cross-leg, jump, run. Okay. So you cannot do anything about these ratios. You can address only your weight. Okay. The first thing which you are supposed to do is address your body weight. Second thing is address the muscle strength which is supposed to carry your body weight. Third thing is maintain a proper lifestyle. These are the very important things which you're supposed to practice. And unless you bring up some discipline post 30-35, which is you are supposed to address your exercising specifically for your muscles and bones, because roughly you lose about 1 to 2% of your bone mass post 35, specifically for women who are postmenopausal. So women who start manifesting early should consider hormone replacement therapy at least in the first 3 to 5 years.
Okay.
Because they quickly lose roughly about 10 to 20% of their bone mass in the first 3 years itself. So it is very important that you get indulged in some kind of physical activity so that it will build up some muscle and some bone mass for you post 30-35.
Very true. Yeah. So, as I said, you have covered already my second question, that what are the red flags and how to prevent it from the age of 30, right? So, doctor, like obesity is one part, right? We understand. When you say about the lifestyle, so have you experienced that stress and the lack of sleep also impact the joint health?
Stress and lack of sleep, definitely you develop some kind of soreness in your muscles if you don't sleep adequately. So that stiffness persists in the morning. So stress definitely manifests some kind of stiffness in your muscles and ligaments. That also will manifest as a pain. But if you sleep properly, okay, if you have a thorough sleep, your muscles will be completely relaxed. So once you have complete relaxation, the stiffness will be less. Subsequently, in the morning, you do some light exercises that should take care of it. So, sleep as such, it is very important that you maintain an at least 6 to 8 hours of sleep. This sleep, most of the people, when we say sleep, sleep is largely for your spine.
Yeah.
So people can sit and sleep also, but your spine is not at rest.
Yes.
So if you say travel in a semi-sleeper and a sleeper, in both the places you are sleeping, but your complete body is not rest when you're sleeper,
Yeah.
semi-sleeper. Okay. Next day you have some kind of rigidness, stiffness in your body. That is, you can understand that you are sleeping. You might have fallen many times on the other fellow, but you don't know how many times. But you never fall on the ground.
Other fellow knows.
Yeah, but you never fall on the ground because your spine is awake and maintaining the posture.
Got it.
So rest for spine is always elimination of gravity. So you should sleep properly, at least about 4 to 6 hours. Once you attain a good sleep, next your muscles are really relaxed.
Very well said, doctor. And we in our wellness practices, we always see that along with the pain management, when we observe the patient is under stress and sleep deprived, and we make changes there, it gives lot of difference, and the prognosis is much better, as you write.
Yeah, it is very important. See, the body is designed cyclically to work and rest.
Yeah.
So people, you don't sleep for 2 days, third day, wherever you are, they will be sleeping. So there is no question of not sleeping at all.
Sure. Yeah. Perfect. So awesome. Yeah. So I will move to Dr. Harsh. Yes. So Dr. Harsh, in diabetes care, we have always heard you about the diabetes prevention and all that. So today my question is not that, right? Okay.
Okay.
So my question today is that in diabetes care, how is AI currently helping to
Right.
identify the risk earlier,
Right. So I think
even before the pre-diabetes?
yes, yes. So I think this is a very, very important question, especially when we are sitting in 2025 and discussing health. So AI is no longer a theory, it's no longer an experiment, it's no longer a concept, it is in action. So now, so there are 3 steps in which AI is actually transforming the way we understand diabetes, number 1.
Yes.
Number 2, after understanding the diabetes, the predictive power of AI, which is data. So
Yes.
if you understand diabetes on a larger plane, we perceived till the technology revolution of last 10 years as a point-based outcome-driven illness. Say you note down certain number of sugar, you make an assumption, you make a prediction, and you do a treatment.
Yes.
But you are not at a level where you have a multiple data points of that evidence. But now because of technology, we have it. So starting with the base data, the data, we pull it from a sensor, which actually records your sugar for 24 hours.
The
So
CGM.
the CGM sensors. And then this data set is so huge that a human brain is not capable to rule out possibilities of so much of data. Now imagine for last 80 years, you're treating with 3 or 4 readings a day. And now suddenly, all of a sudden, you've got 120 readings in front of your eyes in 24 hours. Extrapolating it to 14 days, we're talking at somewhere around 1600 sugar readings. So the quality of your decision making has improved. But then
Absolutely.
at the same time, brain also has a limit to look out for differentials and other tangibles around those sugar fluctuations, which is where AI comes in. So AI has unlimited power to process data, unlike us. So even if you throw it 35,000 sugar readings, it has ability to process it. It has ability to identify a pattern, and it has ability to make a decision based on that pattern to give you an insight that, boss, this medicine, if you're giving in morning, it's not making any impact on sugars at midnight. It's working probably till 6 p.m. in evening. After 6 p.m., sugars are not under control. There's no window of coverage of that medicine. Does it apply for every human? No. Every human body processes a medicine in a different way.
So that brings to that
Exactly.
you are able to customize the treatment now
Exactly.
with this data
AI.
analysis.
So the first aspect what AI has been able to do is customization of treatment.
Superb.
Second is that customization is based on prediction,
Yeah.
which earlier we didn't have the technology to do.
So I think this will prevent the hypoglycemic
Yes,
incidences.
exactly. So there is a factor in AI which is now active
Yeah.
where there is something called trend analysis. Now, suppose a patient comes to me, I don't start immediately on treatment. We first understand the trend of fluctuations of sleep. The body is not manifesting a symptom of a low sugar, but the sensor has that ability to pick it and point out as a red flag that 2 a.m. to 4 a.m. sugars are going down. So all these kind of possibilities, those sensor was giving data. Now, with the trend of those data, AI is now creating predictions. It is even giving dose corrections. In fact, on 30th May, a research paper got published in IJMC where AI beat 500 diabetologists,
Oh my
500
God.
diabetologists
Oh
in insulin dose adjustments. And it was 95% more accurate than a human prediction or a human calculation.
Yeah. Yeah,
So
that
that's
makes
where the
sense.
world is now headed towards. So I think sooner or later we have to embrace it, accept it, and start utilizing at our best patient welfare benefit. So I think that's where the
No,
AI
that
is transforming.
that is very valid, and I mean, I would like to thank you for making our clients aware, in the sense where most of the clients comes to us. No, ma'am, the other wellness doctor says that mango kitna bhi khao, apple kitna bhi khao when you are diabetic, right? Okay, so now with the technology help, we are able to show that this is your report, right? Okay, so you can see that after eating so many fruits, yes, you consult your doctor, understand that how much fruit is allowed to you as per your HbA1c or the prediction of the data values, right? But it cannot be that one person is saying ki we are able to make you eat as many as mangoes even if you have the HbA1c of 9, right? So there definitely we are getting help from the CGM and AI from your help. Great. And Dr. Harsh, what real world results are we starting to see from here on?
So there's an additional tangent to the same discussion. Now, with the power of AI, what's happening is, so there are a lot of mathematical formulas which have been designed to predict certain risks. Like say, let's take heart attack. For a person with diabetes, there's a formula called ASCVD risk. Right? It gives you a calculation of prediction of possibility of a person getting a heart attack.
Yes.
So basically, it's a red flag that you have to go to a cardiologist, get your workup done.
Yes.
Sugar है तो सिर्फ sugar control करने से you're not going to end up completing the entire spectrum of problem.
Yeah.
Now that prediction, that mathematical calculation is now getting offloaded by AI.
Oh, super.
Now what a human brain will take 15 to 20 minutes to calculate say 6 or 7 different formulas of this organ specific prediction, AI does it in less than 30 seconds.
That's great.
So imagine 20 to 25 minutes of hard work is now borrowed down to 30 seconds, and that too you don't have to do it. It's happening at back end.
Yes.
Once you feed the data, it does it at back end. So even before you start a conversation with a patient, if you are fully AI integrated, you know what to talk to the patient or what to educate the patient. So that's what is a make or break aspect when it comes to communication of diabetes and the outcomes to a patient. I think that's where the actual practical applications we are seeing now.
So that again is bringing more precision in our experts' practice.
Absolutely.
Perfect.
Absolutely.
Awesome. Thank you, Dr. Harsh. That was really awesome. So, Mr. Sridhar, yeah. So, you deal with health insurance, right? So, I will say that for clients with lifestyle diseases, right, like diabetes and all, what is one critical clause or the rider they often miss in insurance policies? I mean, this I am asking for ourselves.
Ma'am, thank you for this question. Actually, most of the people doesn't know about the health insurance properly. Whenever they're taking the policies through agents, they will not guide them. Today, most of the people are mis-selling the products. First thing, like if you are having the diabetes, there is a pre-existing clause. Most of the insurance companies will cover after 2 to 4 years. And till that time, if anything goes wrong through diabetic, like heart attack, anything, kidney disease or anything, that will be not covered in the policy.
Oh.
Now, there are some companies who are giving diabetic coverage from day one under the policies.
It is that common,
yes.
right?
And see, India is the now diabetic capital all over the world. As per 2023-24 this study, we have got 136 million people are diabetic in India.
And not even India, like whole Asians are,
so this is the result. So now that 8 years child is also getting a diabetic, we don't know. So that is the reason we are covering diabetic from day one by taking that policies, and there is no limits for the disease.
But people are not still aware about that.
Yes, we are trying to aware the same thing and telling them. that you can take the policies through that is covering from day one. And we are tied up with Dr. Harsh and these doctors,
Yeah.
and we are helping the clients to get the policies.
Absolutely, because still we listen that the person once is diabetic and not insured, so they say, "Ma'am, अब तो हमें मिलेगा ही नहीं."
Yes, and one more
Yeah.
thing, ma'am. Most of the people thinks कि हमने 10 lakh की policy ली, 10 lakhs की policy is more enough. They are wrong. Today you have got one basic policy and a top up policy. If you're taking a basic policy for 10 lakhs, you can go for a top up policy for 50 lakhs, which is very minimal, and that will also help you at the time of any critical illness.
So this top up policy can be combined with the corporate insurance, is what the people
Yes,
get?
yes, it can be combined.
That is
Yes.
really
Yes.
good. Yeah.
But in corporate policies, there is one thing. If you are working in a such company or in on a corporate, that will be coverage. That coverage will be applicable for that year only.
Yes.
Whenever you are moving out from that company, so you will not get a fresh policy with all that benefits. So it is better to have an individual policy, retail policy
Always.
immediately.
So parallel policy should be with
Yes,
you,
yes.
so that you are not getting any kind of, and these days
Yes.
layouts are so common,
high, yes.
so you don't know.
Yes.
But that can be converted into the independent policy also. Still you advise that we should have the buffer policy
Yes,
with us.
yes.
Perfect, awesome. Yeah. And what are the is, for example, in diabetes, right, the financial time bomb in Indian households goes very high, because diabetes is not stay only to diabetes.
Yes.
It go to multiple complications. But the problem is that the kind of indoor requirement is less. Most of the time these conditions, for example neuropathy, right, okay, for example impact on the eyes and ears, this mostly goes with the outpatient treatments, right? So are they anyhow covered, or is there any option
Yes,
for
ma'am.
that?
Yes. So now there are 2 to 3 companies who are giving this optional coverage. If you opt for that coverage, you can get a outpatient treatment for some limited amount, and we are covering under that what is a dental treatment and naturopathy and Ayurvedic treatment also we are getting covered. Outpatient as well as inpatient also. Suppose if I'm getting anything, for example, I'll take my example. I've got a knee spine problem. So I've gone for the treatment to Dr. Josna, and she has treated me for 1 month. So it is like an outpatient only. But for the total treatment cost, I've got a reimbursement from the insurance company.
That's really
Yes,
great.
which is covered under insurance company. So most of the people are not aware about these clauses and coverages. Still, the thing that we have to be inpatient only, then only we will get the claim.
I mean, even I was also thinking the
Yes,
same thing.
these are all the daycare treatments
Yeah.
which are covered under policies. Most of the 50% of the insurance companies are covering.
Even the people miss treatments due to this, specifically the alternative pathy treatments,
Yes.
right, because they go prolonged and it is a high cost, right?
Yes.
So, and it's not possible for everyone to go for the admission, right?
Yes.
So this is really, really wonderful, and we all will reach you out separately
100%,
for
ma'am.
this.
We will cover from day one only. So there is no
Awesome.
waiting period for this.
Superb. And what's the blind spot in most people's insurance that only gets exposed when we take it?
See, same thing I will say again, that people are not aware. Now most of the people or agents or intermediaries, they will say only one thing: if you are getting admitted only for 24 hours, they will get the claim. So we are telling clearly that daycare treatments are covered. So awareness is the most thing that people should know. If I'm there or not, if you're taking a health insurance policy, you should know what are the coverages are
But
available.
is it some person dependent, or there is any portal where we can get this kind of info?
So, ma'am, whenever you're taking the policy, now the insurance company is taking your own mail IDs and contact number. They're sending the policies over WhatsApp and your mails. If you'll go through the policy conditions, everything is mentioned in the policy.
So it depends that we need to be wise enough to go through the terms and condition properly, and then have to explore that.
See, if
What
you
are
are
the
having
other-
the proper agent or intermediary, he can guide you. That is enough for you. If he's standing beside you for each and everything, while from making policy till the settlement of claim, that is enough for you. So we'll provide that services. So to each and every client.
You understood what? Yeah.
Thank you.
Sure. Thank you. So we are done with these all questions. Quickly, I will just run through one question and we all can participate in that, that how we are integrating tech, as Dr. Hirsch has already covered that they are integrating the CGM part and the AI part over that to have the more predicted data and to have the more precise and the customized treatments for their clients, right? Okay, so I would like to hear from all of you one by one. We can just go with the mic and tell us.
Yeah, technology, that is one of the basis. That's the basis.
You are the technology.
Yeah,
only.
that is the main thing. And you were talking about.
We need to embrace that.
You were talking about analytics.
Yeah.
I am very sure we already have a system for that.
Oh, super.
It's just we have to change a few things and we're able to get it set. And that's the same thing with a lot of these. That is the same thing with technology. You find out what the problem is. And like I
So
said,
for
you
you,
come
my
up with a
question
solution.
will reverse. How are you integrating wellness with technology?
Wellness?
Huh?
What? Ah, yeah.
No, not for
Make it
himself,
convenient.
with the system, like when it is going to the people, right? Okay, so I mean, for example, when it is going with the insurance companies, right? Okay, if we integrated the EHR system with insurance, okay, so it is going to tell us that the if wearable data is also going to the EHR, right? So it is going to tell that how many steps the person is taking averagely, how possible it is for the person to get diabetic, right? Okay, if the person is not walking enough, if my sleep pattern is going through my wearable to the EHR, right? Okay, so it is going to predict the issues coming much
You
earlier.
mean, okay, I understand. The patient always is in a way monitored.
Yeah.
So that they're always checked and the software is able to make sure that
If it is coming
it's
to your
able to predict it
EHR
itself.
and going to the physician, right? So then I think you will be able to integrate
Yeah.
the wellness with the EHR.
Yeah, I think that is something that can be done in the future because that takes, obviously,
That
it's a
future
lot
we
of
need now.
different things coming together. And
Perfect.
that is the thing. In history, a lot of different things have to come together to come to one single solution.
Yes.
And a lot of these are coming into place.
Yes.
It's just a few more steps, and I think we'll be able to get to a place where we are able to predict patterns and
Yes.
come up with a solution. A doctor is able to get the whole picture of their lifestyle.
Absolutely.
I think that is,
we look
one
forward
of
for
the
that.
great things,
Yeah,
yes.
thank you.
So, ma'am,
Yes.
coming to a point, actually now most of the insurance companies are giving this BFIT benefit.
Yes.
If you are like you said that if you are walking, if you are means wearing a smart watch and you are walking at 10,000 steps or anything, and you are posting the same thing in the app. So next year on the renewal, if you are maintaining your health properly,
Premium is reducing.
yes, the 10 to
Absolutely.
15% will get more discount
Yeah.
over that. And second thing, technology is now very helpful. Now most of the insurance companies, they are giving every year they are giving free health checkups to each and every client, so they can know about what are their how they are fit and how they have to improve themselves. So we are giving all the technology benefits under
Perfect.
insurance.
No, very well said, and the efforts are taken, which is very appreciable, and I will really suggest, which you can convey to your insurance policy people, that please add the wellness
Benefit.
parameters also. For example, the body composition analysis itself will make a lot of difference in that, because the BP, the sugar,
Correct.
that comes late enough,
Yes,
right?
yes.
Sure, thank you,
Thank you.
Ji.
So one way that we use technology is that gone are the days when we had to look at a film of just 1 inch and then decide whether the root canal is done perfectly or not. Now we have digital X-rays where we can look at a screen that is the size of a laptop screen, and then we can just blow it up as well. So even the minutest of detail is not missed.
Oh,
and then with physical X-rays, you had the chance that it could be lost. Whereas here the data is saved in the cloud. So you have access to historical data.
Yes.
So you know that the patient had a decay at this point of time, and then it has progressed to this particular stage. Or he may have been disease free, say about a year back, and in a year this much of tooth loss has occurred. So we know that how fast the disease is progressing, how fast, where it is progressing, in what direction it is progressing. So that way it is much easier to track and treat as well. That's how we use technology for providing better solutions for our patients.
Superb. So I would like to mention here that I would not name the company, but there was a company who was taking the films, and that company was providing this facility to all the ultrasound scans and all x-rays, each and everything was coming on their films, right? Okay, so now that company has played so well that they have integrated this all data lying with that and converted it with the help of AI in the precision diagnosis, and the duration now of their diagnosis is less than 2 hours in one go, and the whole system is scanned, report is on the paper, and the radiation which is used is much lesser than what was earlier used with all the help of with the data saving and the AI.
Yes, of course. I mean, previously when you had films, right, the exposure time would have been, say, about 0.2 seconds or 0.25 seconds, at least minimum, so that the film records it perfectly. And then you had to go develop it, fix it, and then you wash it. And if there was even a procedural error anytime, the film is gone waste. So again, the patient had to be exposed to that particular radiation. Whereas now with the newer technologies, it's much easier. You have a digital sensor, the radiation time or the exposure time is less than 0.1 seconds, which is much quicker, and you're able to instantly analyze the results then and there.
Wow.
And blow it up, analyze it, look at it, and then treat accordingly. So it's much, the radiation itself has decreased, the exposure has decreased a lot, and also the treatment outcomes are better because there are better diagnostic tools available.
Awesome. That's great.
Thank you.
Thank you.
So with regards to our treatment procedures and with the patient data, we are yet to integrate the AI into the system. So we are exploring on that, and we will be definitely integrating. That will really help.
Awesome, doctor. I think already you have taken one part of the technology, but we went through your morning insights, that ozone therapy, right?
Yes.
So which is the powerful technology
Absolutely.
Integration, right?
Absolutely,
Awesome,
doctor.
superb. So pranayam ki shakti tripled.
Absolutely.
Yeah, awesome. Thank you, doctor.
Thank you for
Dr.
that.
Nisha.
I would say about my subject, there's not much online, and don't believe anything which is online, because not all of it is true about my subject, especially because it's new and there are a lot of myths about it. I cannot integrate it with technology. It's a very personalized medicine, and it differs from patient to patient, disease to disease, and depends on the severity of the disease also. I would love to integrate it, but right now I don't see it as a possible option.
That's superb. Being so honest and transparent.
Robotic knee replacements. So what a robot does is it does a 3D mapping of your joint. It helps in taking an accurate cut of the bone, and it helps in positioning of the implants very accurately. So a lot of patients are really, when they come to OPD, they ask like, is robot a must? Definitely not, but if you can afford, it is good. Yeah. So we should not reject any kind of new technology, because as a race, humans are dominant on this planet only because of their ability to use a tool. Without a tool, maybe you can't fight with a dog also. With a dog also, you'll have to have a stick to fight. So it's only because of our ability to use a tool we are dominating. So we should be very accepting for the new technology and try and use it, and just not discard either because you don't have or you don't afford it. Yeah. So definitely in every aspect of life, we are using technology, and technology has a role.
No, I mean, in your area, the robotic arm has done the wonders, right?
Yeah.
So the kind of like the number of surgeries which were failing before the replacement and all, that has been reduced a lot.
Yeah. So it basically helps in understanding. It is like navigation.
Yes.
So navigation, when initially it came, only a few vehicles used to have. Now it comes inbuilt.
Yes.
So it's just matter of prosperity. If every hospital has a robot, probably everyone will undergo robotic knee replacement.
Perfect. Awesome. Thank you, doctor. Would you like to add, Dr. Harsh, what you?
Yeah, I've already spoken on it.
Perfect.
I think we are doing quite well. Yeah.
He's chalta fitta tech.
So in our case, specific to technology, I deal with hearing aids. I prescribe hearing aids. and I also check for candidacy when it comes to cochlear implants.
Okay.
So hearing aids are electronic devices which have to be worn for the whole day. So it has to be able to amplify sounds to about 80, 90, 100 decibels or so, and still give you the battery life of like 16 hours, 17 hours, 20 hours is the expected battery life.
Oh.
So technology has come this far that very tiny device that sits behind the ear can give up to 51 hours of battery life.
Superb.
Rechargeable
Superb.
hearing aid. They are IP68 or beyond. That means it can be submerged inside the water for at least 1 meter. So patients don't need to really worry about their hearing aids really when they are in rain or by mistake if they go under the shower or so on. They are pretty robust and stuff. And when it comes to signal processing, hearing aids have already incorporated artificial intelligence, and because of the neural processing unit, the chip inside the hearing aid, they can process sounds to about like 8 billion times of processing
That's
per
awesome.
hour. So that's huge amount of processing to be able to classify sounds in the environment and enhance speech. So because of hearing loss, people have difficulty understanding speech in presence of noise, and the hearing aids nowadays are so good that they can pull speech out of noise. The current research done by a hearing aid manufacturer called Starkey, where their newest generation hearing aid, they have kind of created that situation of signal to noise ratio of minus 3 dB.
Oh.
That means noise was 3 dB above the
Yeah.
signal of interest. And from that, the hearing aid could give the positive signal to noise ratio of plus 7 dB.
Oh, that is.
And after injecting an additional AI algorithm, they could increase that to 13 decibels. So that is the level where they have come into. And we prescribe those hearing aids, and people who are interested in such wonderful devices, we are very happy to dispense
Awesome.
those.
So new generation will say, then let's enjoy the music. This aid is already there.
So all this signal processing has to happen. जैसे आप बात कर रहे हो, and if I'm a hearing aid user, it has to happen without I having a lip sync wala delay.
Oh.
So when you speak and I hear this, I should not feel that you're speaking and then I'm hearing after a few seconds.
Yes, yes. It is
has to
simultaneously.
happen, it has to happen simultaneously, and it happens within 20 milliseconds.
Wow. Yeah.
That is this criteria, and it is so difficult for me to, after taking history and after doing the tests, correlate with each and give a perfect specific diagnosis, where Notebook LM plays a very good role for me. I love the tool.
Wow.
I inject all the criteria. I need to put a little, not little, significantly less effort to be fast with the patients and to really push it to a specific healthcare professional, whether it is neurologist, whether it is ENT, or if I myself have to do certain vestibular rehabilitation therapy or therapeutic maneuvers to deal with the issue. So that
Very
is
well,
how I
very well explained. Yeah, no, I mean, this is all right. So the people who were really suffering with this, and due to the diabetes or due to the aging impact and multiple others, right, this was a major issue. So if it has been covered so beautifully, that's blessing.
Perfect.
Superb. So quickly we have covered this part, so we will cover the session, and I would like you to just keep telling one wellness habit which has made difference for you yourself.
Okay.
You can
The wellness habit that
quickly.
the wellness habit that made a difference in my life is being selfish for my
Oh
own
my
health.
God.
So you have to be selfish for your health and not compromise on your health.
Awesome.
Whether it is you want to make your health better or either ways. कभी-कभी कुछ अच्छा
Let's take
मुझे
it
खाना मन
positive.
करता है. ऐसे. Anyway, thank you.
Superb.
So for me, it's almost like 10 years. I've been digitally disconnected, though I do a lot of
Digitally,
tech.
you disconnected.
Yes, though I do a lot of tech, I'm digitally disconnected on social front. So The human interactions which I have been maintaining over time, over almost a decade, has been a person to person rather than a message way or any social media way. So basically, staying away from the convention nuances of being part of the digital media is what has actually helped
So
me scale
social
up.
media you have cut
Yes.
down, right? That is awesome.
And that too at a time when it was peaking. So I kind of I missed the bus when the bus was renovating, and then I'm benefiting from it because
That is
I
big
have plenty
benefit.
of time now to
Yeah.
focus on other things.
Super.
First thing is on my food. I'm maintaining an eating window of about 8 hours. So largely,
Intermittent fasting.
yeah,
Awesome.
it's about 8 hours of eating window, 2 meals a day, and at least about 3 to 5 days in a week I try to maintain an exercise protocol. It involves a little bit of gym, swimming, and a little bit of yoga.
Awesome. That is great. That is great. you are inspiring us.
So I take a nature walk every day, at least for 1 hour in the evening. That's a must for me.
Super.
So I miss all the parties, everything, just for that nature walk, and it's a super stress buster for me.
Wow.
So,
That is
yeah.
So this is awesome because it goes reverse. People miss the nature walk or the gym or
I
anything
know.
for the parties, right?
So I am addicted to it. So
Awesome. That is great. Yeah.
So one wellness habit, or I would say a blessing that I have, is sleep at least for 8 hours in a day.
Wow.
And the moment I hit my bed, I just fall asleep within 2 minutes. And wherever, if I have to sleep, I can sleep.
Wow,
There are no
that is
particular
awesome.
things.
That is
Yes,
awesome.
that's one blessing that I have.
Super.
In the days where people are really suffering from insomnia because of various reasons. That's one thing. And practice of definitely yoga, pranayama, and meditation.
Super.
At least 5 days in a week.
Awesome. That's awesome. Yes, thank you, Doctor.
So one thing that has helped me in my journey is I've stuck to the age-old tradition of starting with the dessert and then going on to the main course. Because if you eat the dessert at the end, you are consuming a lot of carbohydrates and they're usually sticky, stick around in the mouth, and they cause tooth decay. And thankfully, in spite of being an ice cream and a chocolate lover, I
So
still
you
don't have any
take
decay.
it in before.
Yes.
That is a tip
So,
for us.
Yes, that's a tip.
Thank you.
So start with the dessert and then move on to the main course.
Superb. Then take the soup in the last.
Soup skip ही कर दो मैडम क्या है पानी है वो your body is composed of water छोड़ दो soup important ही नहीं है.
So I am following his advice. Not about habit of having food. Actually, I'm having a brush twice a day, and I'm having a lot of water.
Washing all the desserts.
Yes, and I'm having a lot of water. Earlier, I used to have only 1 to 1.5 liter water. Nowadays, I'm having around 3 to 4 liters water, which is helping me to keep me fit and slim. Thank you.
Superb. Awesome. Hydration is good. Yeah.
Yeah, I hang around with all the doctors, so that helps a lot.
So, but you have adopted for yourself.
One thing is, I think picking up a sport is one of the best options. People struggle to always go consistently to a gym. And instead of that, if you take a sport, it makes you more competitive.
I absolutely
so
agree with you.
Want to go, you have a lot of social interaction. So it always, and first 2 days might be a little hard, but once you get used to it, it's very easy to keep going there. You meet people, you start being competitive, and it's very enjoyable also.
So keeping your hobby as a physical activity.
Yeah,
Super.
it's a struggle to, it's comparatively easier. That's what I would say.
Awesome. So I really loved thoroughly having the all insights from you all about your integration of the technology and sticking to being expert of your subject and being so busy still adapting wellness practices. So definitely this will be a benchmark for our all audience and the people who are attending us online. Thank you so much, and let's be interactive and keep doing this all panel discussions and more interactions this way so that we can bring more and more awareness. Thank you all. Thank you. Any questions? Any questions from anyone? Huh? All understood?
Yeah.
ठीक है. Yeah.
इधर ही कर लो ना. हाँ. Let's go. Thank you. Thanks.
Yeah, we
मैंने सोचा था छोटा करना है. बाद में पूछ लो. हाँ, अभी करवा लो इसी.
Session for all of you. Just leave all your stress aside for a while and laugh like no one is watching you. So I call upon Bakula ji onto the stage. Bakula ji.
मैदान में आ जाओ, नमस्ते। कम ऑन, अरे डेजिग्नेशन छोड़ दो, एक जमाने में मैं भी टीवी पे चमकती थी, आ जाओ। आज सबके बीच में हूँ, आ जाओ आ जाओ आ जाओ आ जाओ आ जाओ भाई, हंसना ही है। गुज्जू एक कहावत है, हंसे नु घर वसे। जगजीत सिंह ने भी एक गजल कही है, हंस के बुला करो बुलाया करो। लेट्स स्टार्ट विद द नमस्ते। एक दूसरे को करो, एक दूसरे को सबको करके आओ। नमस्ते नमस्ते। से एवरीबॉडी कम इन सर्कल। नमस्ते। नमस्ते। हंसने में कौन शर्माता है भाई? कौन 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 कौन? कम ऑन सर, हंसने में पैसे नहीं जाते। आ जाइए आ जाइए, अंदर आ जाइए। बस बाकी सब कहाँ चले गए? हाँ, कॉल एवरीबॉडी। सेकेंड एक्सरसाइज, घर में मोबाइल का बिल आता है, लाइट बिल आता है, बहुत लंबा आ रहा है तो पापा वेट करते हैं, चलो उस पे हंसेंगे, ठीक है? सो मोबाइल का बिल है एक हाथ में। सो इफ यू आर फीमेल, रेगुलर लाभ प्रैक्टिस करोगे ना, ब्यूटी पार्लर नहीं जाना पड़ेगा। वैसे खूबसूरती सबको अच्छी लगती है, इट्स नॉट वो इजारा नहीं है फीमेल का, ठीक है? चलो नेक्स्ट एक्सरसाइज करेंगे। आप कश्मीर गए हो, बर्फ बहुत पड़ रही है, कार बाहर पड़ी है, बर्फ में जम गई और मार रहे हो चाबी, ठीक है? मारो चाबी। चलो करो एक्सरसाइज स्टार्ट। स्टार्ट योर कार। कम डाउन। सब लोग पार्टिसिपेट नहीं कर रहे हैं, क्यों? सबको देखना थोड़ी है। कम ऑन, दिस इज फॉर यू। हंसना ही है, हंसने के पैसे नहीं लगते हैं। कम ऑन, कम डाउन। अरे दवाइयां लेके थक जाओगे, हंसने से वो जरूरत नहीं पड़ेगी। आ जाओ अंदर, मैदान में आओ। कम ऑन कम ऑन कम ऑन कम ऑन कम ऑन कम ऑन। नेक्स्ट, या मेक अ राउंड। ये आपके लिए एफर्ट्स हो रहे हैं, ठीक है? चलो नेक्स्ट। सब लोग बच्चे थे, सब लोग जवान भी थे, अभी है कितने हैं? अच्छा ठीक है, सब लोग बुढ़े भी होंगे। बच्चे थे तो कैसे हंसते थे? Come on, start. नेक्स्ट, क्यों बैठ गए सर? अरे कुछ नहीं होता, अरे इंश्योरेंस आपका आ जाइए। अरे इंश्योरेंस है, लग जाएगा। चलो नेक्स्ट, यंगस्टर्स कैसे हंसते हैं? इतने सीरियस होते हैं? अरे बाप रे, तो पेशेंट और ज्यादा बीमार हो जाएगा, है ना? चलो नेक्स्ट, बूढ़े लोग कैसे हंसेंगे? ओल्ड एज। Come on, let's start. Do the acting. एक दूसरे के पास घूमिए सब लोग। तो आप ये करेंगे ओल्ड एज लोगों के बीच में, तो आपको काफी सारे पेशेंट्स मिल जाएंगे। यस, नेक्स्ट। किसी को इंटरेस्ट नहीं है तो बंद कर दे। पार्टिसिपेट। अरे ऐसे कौन कर रहा है? अरे सब डॉक्टर से कौन हाँ, बाकी सारे कहाँ चले गए? चलो, अरे बाप रे, ठीक है। नेक्स्ट प्रैक्टिस। थोड़ी ब्रीदिंग प्रैक्टिस करते हैं। हा हा हो हो, 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 हा हो हो, हा 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 हा ho ho ho, ha ha 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 ho ho ho. Relax. Take a deep breath in. Breathe out. Lymph node practice. Lymph node. You know? Lymph node. Lymph node. This rule is 9 rule. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 10. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1. Relax. Breathe in. Breathe out. Inhale. Exhale. इतनी फास्ट सांसें कौन लेता है? सांसें कैसे लेते हैं? सबसे अच्छी सांस कौन लेता है? नहीं, नहीं, हाँ, जस्ट बॉर्न बेबीज। हाँ, तो वो आगे चलते रॉन्ग क्यों हो जाते हैं? क्योंकि वो आपको देखते हैं, हमें देखते हैं। हाँ, हाँ, कंफ्यूजन, स्ट्रेस, स्ट्रेस एंड ऑब्जर्वेशन। ऑब्जर्वेशन इज द बेस्ट टीचर, वो हमसे ही सीखते हैं। नेक्स्ट, सबसे अच्छी सांस लेता है सांप, सबसे अच्छी सांप लेता है कछुआ। ठीक है, चलो नेक्स्ट प्रैक्टिस करेंगे। ठीक है, ब्रीदिंग प्रैक्टिस है। इनहेल, exhale. Inhale, exhale. Now make a sound, huh? Inhale. रेडी पूरे दिन, लास्ट प्रैक्टिस। कभी गौर किया बच्चे इतने क्यूट क्यों होते हैं? वो हंसते हैं दिन में 400 बार, और हम कितनी बार हंसते हैं? नहीं नहीं, आपको पता चला कि ये क्लाइंट बड़ा है तो आधा घंटा, 1 घंटा जब तक डील फाइनल नहीं होती है ना। हाँ, वो भी कैसा, इससे ज्यादा नहीं। नेक्स्ट लास्ट प्रैक्टिस, चाय बनाते हैं मॉर्निंग, खड़े हुए हैं बेड पर से, चाय बनाएंगे, किचन में जाएंगे, पता है दूध सेहत के लिए अच्छा नहीं है, फिर भी चाय, शक्कर अच्छी नहीं है, फिर भी चाय, और एवरी टाइम हमें हंसना है। चलो गैस का नॉब ओपन किया, यूटेंसिल लिया, यूटेंसिल को गैस पे रखा, स्टार्ट, चाय बनाओ। अरे ऐसे, हाँ मैं सिखाती हूँ ना। हाँ चलिए, अब पानी डालिए अंदर। दूध भी डाला। सब वही तो हंसना है। शक्कर अच्छी नहीं है हेल्थ के लिए, फिर भी डालो। अब आएगी ना। तो चाय बनाना आता है इसका मतलब। अब डालो चाय की पत्ती। कैसी बनेगी? योर टी इज रेडी। चलो थैंक यू। पसीना हो रहा है? हो रहा है?
तो सुबह मिस कर ले
हाँ?
Hi, I am Dr. Virendra Muddu, consulting orthopedic surgeon at Apollo Spectra Hospital, Kondapur, Hyderabad. I am specialized in joint replacement and arthroscopy procedures of the hip, knee, and shoulder. Today, let me give you an insight on what are the few wellness habits which you can practice in your day-to-day life so that you do not develop an arthritis in your knee joints. Let me make you understand few important things which you're supposed to check. One is your body weight, your muscle strength, and your bones. The basic understanding is your weight is definitely carried by your knee joints, and the wear and tear which happens in your knee joint is directly proportional to your body weight. The pressures which develop in your knee joint is roughly about 1 to 1.5 times of your body weight when you walk. It is about 3 times when you take a stair. It is roughly about 4 to 6 times of your body weight if you are squatting, sitting cross-leg, or if you are running or jumping. So the pressures are directly proportional to the body weight. So one important thing you're supposed to do is do not put on additional weight. The second important thing is the muscle strength of your knee joint. Muscle is like an engine for your knee joint. The strength of the muscle is directly related to how well you exercise. So you got to develop certain physical activities on a daily basis in your day-to-day activity so that you do not develop muscle weakness. There is a natural tendency for the body to lose muscle mass post 35 to 45 years of age. So it is very important that you do moderate to vigorous physical activity at least for about 30 minutes, 5 days a week. You should keep a variation in physical activity, specifically maintaining into 3 subcategories. One is strength building exercises, stamina building exercises, and stretching exercises. The strength building exercises are your resistance exercises or weight lifting exercises which you normally practice in your gym. It could be simple floor exercises, your lunges, squats, leg press, leg curls. All of this come under the category of strength building exercise. The second set of exercise is stamina building exercise, which will largely improve your cardiopulmonary reserve. Running, walking, brisk walk, jogging, swimming, cross trainer, swimming, all of this come under stamina building exercise. Then third thing is your muscles tend to become stiff, your ligaments tend to become stiff when you age. So you got to allot a certain amount of time in your exercise for stretching. You could do dynamic stretching exercises, static stretching exercises, or you can learn some asanas and keep practicing the yoga asanas on a regular basis. We usually recommend at least about 2 to 3 days of strength building exercises, 2 days of stamina building exercises, and 1 or 2 days of stretching exercises in a week. Another important factor which we are supposed to practice is weight training exercises so that your bone doesn't lose its mass. Specifically for women who are postmenopausal or around 50, they tend to lose bone mass of at least 1 to 2% a year, specifically because of low hormones. So women who are in postmenopausal period should consider hormone replacement therapy and discuss this with their gynecologist so that they do not lose the muscle, they do not lose the bone. So bone building exercises are also important. Few important things which you're supposed to do so that you do not lose bone mass is 1, strength training exercises, weight bearing exercises, avoid alcohol, smoking, and too much of caffeine. Consider hormone replacement therapy if you are postmenopausal or in your 50s. Maintain a good nutrition so that you have adequate supplements of calcium, vitamin D3, and good amount of protein in our diet. Thank you. Pochinda?
Thank you so much, sir.
Thank you.
Sir, ఇంకా వేరే అవునా ఓకే ఓకే మ్యామ్ ప్లీజ్ Okay. 1 second. అక్కడే చూపిస్తే బాగుంటుంది. वहाँ पे खड़े होके
बट कहाँ पे? यहाँ पे? This is too far, right? Not at all? Okay. No, I'll stand at one place, no problem. I'll just move my hands and all a little.
Yes, done. That's okay. Ikkada? Little bit.
Yeah?
Yeah. 1 second. On my phone, another session.
Sound healing session we have after this.
Ma'am, you ready?
Yes.
Okay.
Yes.
Jerry?
Yes. Okay. Yeah.
Rolling. 3, 2, 1, start.
Hello everyone, I'm Dr. Ambika. I'm a clinical dietitian, pediatric dietitian, and also a lactation counselor. And in this video today, I want to talk about pediatric obesity, which is nothing but childhood obesity. It has become a very common problem these days. Every child we see, like every third child I see is suffering from obesity. Well, why is this become so prominent? Let us see that the root cause of this is starting from the kitchen of the house. We do not know where to stop. We do not know where to stop. Sorry, lost it.
Ma'am, please don't move like this, ma'am.
Oh,
It's a right frame, so
I am used to it. No problem. I'll stand still.
One second. Writing down. Okay. Ready? Rolling. Action.
Hello everyone, I'm Dr. Ambika Niranjan, founder for Nutrition with Ambika. I'm a clinical and pediatric dietitian as well as a lactation counselor. Well, in this video today, I want to talk about the immunity of the kids that is going down with each passing day. Well, what is the root cause for this? Let us see that how much are we breastfeeding our kids. Immunity starts right from day one. an exclusively breastfed kid, which is breastfed for 6 months and then breastfed for 2 years, is very well on its immunity because they are getting all their nutrients. Apart from that, we also need to consider starting the nutrition right. At 6 months, when we start complementary feeding, please consider meeting a pediatric dietitian so that we make sure that all the nutrients are getting covered in it. And obesity has become one of the major problem these days. As I say this, it's raining and I'm loving this feeling. Well, obesity has become one of a major concern these days. So do understand that why is it happening. Do consider giving your kid meals from family pots, and also understand and work on increasing their physical activity and also reducing on their screen activity. Apart from that, correcting their diet. You need not always see whether your child likes that food or not, or do not give distracted feeding, or do not give screen feeding. Rather than that, please see to it that you are giving the right amount of feeding as a family meal. Hope these tips were helpful. Thank you. It started raining.
So, Doctor, once more we will meet. Maybe you can come this side.
Huh?
Testimonial, like about the place
Sure.
and the today's session. आप इधर आ जाइए.
Same frame बेटी के लोपला कुछ मन ले रहे हैं.
Can you please sit here, ma'am?
Sit, I don't want to sit. I will stand and give 2 minutes notice. Because we again have to change and come for the sound healing session now.
Okay. So please come this way.
This side. Okay. But there is no good lighting now, right?
No problem.
Is this okay? I think this background will look good.
We are putting like on this back. Okay. Once come and see this one.
So you have already settled the background or something?
No, this background is coming so nice when you were speaking.
Yeah.
So.
ठीक है?
Yeah.
Is it on?
Yeah.
Okay. Okay.
3, 2, 1.
Hello everyone, I'm Dr. Ambika. I'm a clinical dietitian and a lactation consultant. I'm here at the Pragati Sparsh Wellness Resort today.
Control Alt Heat Sparsh.
Control Alt Heat Sparsh. Okay, done. Yes.
Even if you don't want to say long, say only Sparsh.
Okay. Sparsh Wellness Resort? Okay.
I think someone holding it will do.
Is ready, ma'am?
Yes.
Start.
Shit. Okay, start. Hello everyone, I'm Dr. Ambika, founder for Nutrition with Ambika. I'm a clinical dietitian and a lactation consultant. I'm here at the Sparsh Wellness Resort today, and I would love to, like tell you how beautifying this is. The food that they provide, the ambience, everything is healing, detoxifying, as well as soothing. And they have a lot of sessions and lot of programs which will help you, like recreate yourself and also overcome all the stress that you've gone through. If you are looking for a, like recreational day for yourself and for your whole family, do consider visiting this place. Thank you. Okay? Yeah. अरे अगर पता है क्या बोलना है तो हो जाता है.
Thank you, ma'am.
Thank you.
తీసేయాలనా? Hello. Hi. Hi, this is Dr. Ajay Lahoti from Comfort Dental. We have clinics at Banjara and Himayat Nagar. We specialize in providing treatments that are pain-free, and we provide treatment that are provided by specialists in their own field. So if you need a root canal, we provide them with a root canal, and if you need a surgery, it's done by a surgeon. I would advise everybody to brush their teeth twice a day. Make sure that you rinse after every single meal, and also please do use a water flosser. A water flosser actually helps you to remove anything that is stuck in between your teeth. These 3 habits will go a long way in helping you reduce tooth decay and also fight gum disease. Thank you. కంట్రోల్ హాల్ డీల్ కదా, కంట్రోల్ హాల్ డీల్ కోసం చెప్పాలి కదా. ఫ్యాట్ వస్తుంది అయ్యా, ఉంది వస్తుంది కదా. అలా చెప్పాలా మొత్తం మళ్ళీ స్టార్టింగ్ నుంచి. Hi, this is Dr. Ajay Lahoti from Comfort Dental Clinic with branches at Banjara and Himayat Nagar. We specialize in providing customized treatment to our patients. So if you need a root canal is done by a root canal specialist or an endodontist. If you need a surgeon, we will get a surgeon who does great surgery for you, and the treatments are pretty much painless. My tips for prevention of tooth decay and gum disease are: brush twice a day. Make sure that you rinse your mouth after every single meal. Whenever you eat something or drink something, make sure that you rinse your mouth. And also use a water flosser. A water flosser actually helps remove anything that is stuck in between your teeth. Rather than using a toothpick, please do use a water flosser. And these 3 habits will go a long way in preventing and controlling dental diseases such as tooth decay and gum disease as well. Thank you. Hi, this is Dr. Ajay Lahoti from Comfort Dental with clinics at Banjara and Himayat Nagar. Great work is being done by Alt Control Heal, and they are providing holistic treatments in next clip है కదా. हेलो अनिका, मैं थोड़ी देर में बात करता हूँ. वीडियो ले रहे मेरा 5 मिनट, मेरा वीडियो ले रहे हैं. ओके, बाय.
Okay, yeah, ready? 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 Okay, ready? 3, 2, 1, action.
Hi, this is Dr. Ajay Lahoti from Comfort Dental with branches at Banjara Hills and Himayat Nagar. We have found that a great association with Alt Control Heal, and they're doing great work with regards to providing a holistic treatment for all of their clients. They approach the problem from a multifaceted approach involving various other specialties as well, depending on the needs of the client, and that provides a great outcome or a great treatment outcome for the patient. And the patients are actually they heal faster, and they last. The treatment results also last longer. Hope this helps. Thank you.
Thank you.
Okay.
Yeah. Okay.
Thank you.
Thank you. Thank you, Kalnish. Next, on this side. అటువైపు పెడదామా ఫ్రేమ్ సెట్ లైట్ దాని ఫ్రేమ్ అటు అటు ఇదే బెటర్ పర్స్పెక్టివ్ అటు సైడ్ నుంచి ఇటు సైడ్ ఉండదు
Is it good? ఏం లేదు ఏం లేదు మీరు ఇది యూట్యూబ్లో కూడా అప్లోడ్ చేస్తున్నారు
డైరెక్ట్ అప్లోడ్ అవుతుంది
ఓకే లైవ్ కాకుండా నార్మల్గా కూడా అంటే షార్ట్స్ లాగా అనుకున్నా
మీకు
ఓకే
తెలియదా నేను అప్పుడే చెప్పిన పొడుగులా అది రాదు రెండు రావు రెండు రావు
ఓకేనా
వస్తుందా
సార్
నాకు కనిపిస్తలే మరి ఈడ. నీకు వస్తుందిగా వచ్చిందిలే
integrate each of the departments with each other.
వస్తుందా
సార్
నాకు కనిపిస్తలే మరి ఈడ. నీకు వస్తుందిగా
చెక్ విత్ వైష్ణవి చెక్ విత్
ప్రియాంక మ్యామ్
కొంచెం చేతి జరిపి 3, 2, 1.
I specialize in software for hospital labs and diagnostic centers. We understand how each department in the hospital, a lab and a diagnostic center works, so that we're able to give them tailored solutions to solve and every problem that they have. They're able to conserve time, make their lives easier, make the amount of effort they need to put in reduce. Now, we are also able to integrate different parts of a hospital into one another. For example, we are able to connect the doctors with labs, the doctors with diagnostics, we are able to connect them with pharmacies, integrate them all with each other into the front desk, and we are able to show all the data that is given from a hospital, from the patients, from a doctor to whoever needs to be shown that data. Not only that, we maintain patient records. One very important thing is there might be patients that come over 10 years a lot of times, once or twice, once every 2 months. We are able to provide a way to maintain all of the records in a clear, concise manner so that it will be very easy for the doctor to give a proper assessment. And they already have information about the prescriptions and the procedures that they have gone through to make their assessment even better.
Record all this.
Next, we go to this. Okay, retake this first.
I think they're going to start now. The maths laid down. The maths laid down, so they will start now.
వాళ్ళు మ్యూట్లో ఉంచి డాక్టర్స్ మాట్లాడేప్పుడు ఆడియో పెట్టు ఇది అయిపోలే మళ్ళీ వస్తుంది నువ్వు అబ్జర్వ్ చేసుకుంటా ఉన్నావు 3 2
Hello, I'm Ram from MedFile, and we specialize in software for hospitals, labs, and diagnostic centers. What this means is we understand how each part of a hospital works, whether it's the pharmacy, a diagnostic center, or how a doctor deals with.
Cool.
Okay. అందరూ ఒకటే ఫైల్లో చేసేసారా?
సింగిల్ టెక్స్ట్ అయిపోయింది అంటే ఒకరిద్దరు వచ్చింది అంటే 2 times అట్లా రిపీట్ చేశారు అంటే తడబడుతూ ఉంటారు కదా
ఎందుకన్నా సెట్ అవ్వలేదు నాకు. Okay.
Ready?
Yes, ready?
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 Yeah.
Hello, I'm Ram from MedFile, and we specialize in software for hospitals, labs, and diagnostic centers. We understand how each part of a hospital works, whether it's the front desk, the management, the lab, or the diagnostic center, or the pharmacy even. We are able to integrate all these parts together and make them function as a complete unit. And not only that, we are able to make each part of it work separately very well. We are able to remove any inconveniences and make the time spent on any unnecessary tasks reduce. We also keep patient records. There might be patients that a doctor sees who need continuous visits over time. We are able to keep patient records so that the patient does not need to worry about keeping the records themselves, and the doctor can rely on properly attained records and on perfect dates. Not only that, we make a lot of other improvements overall, whether it's outpatient billing, inpatient billing, the connection between different departments in a hospital, and we are able to provide any tailored solution that you want as well.
About the event.
అది ఇంకొకసారి కదా
ఇది అయిపోయింది ఇక్కడ క్లోజ్ అయిపోయింది నెక్స్ట్ పార్ట్
రోలింగ్ సడన్గా రికార్డ్ అవుతే హాయ్ అనేది రికార్డ్ కాదు తెలుసా ఫస్ట్ ఫ్యూ సెకండ్స్
ప్రియాంక
I talked to Priyanka for ordering it. It was a great event, and also thank
location కూడా this location.
Hello, I'm Ram from Medfile, and it was a great event over here. I thank Dr. Priyanka and also Sparsh for holding this event. I was able to meet great doctors here, and we had a great time.
Just like testimonial, అంటే
Okay.
Rolling. Hello, I'm Ram from Medfile, and I'm here at Sparsh today. We came to an event hosted by Ms. Dr. Priyanka. It was a great event. I was able to meet a lot of doctors, share a lot of information. They focus on preventive medicine and whole wellness retreats, which seem like a great solution and a very useful thing in today's age. Actually, మళ్ళీ ఒకసారి చేయొచ్చా?
చేయండి పర్లేదు.
Wellness retreats, holistic approach to health.
లైవ్ హోల్డ్ చేస్తాను.
జస్ట్ దీనికి ఒక వీడియో పెడితే చాలు. కానీ కెమెరా
వీడియో పెట్టేసుకున్నా. లైవ్ క్లోజ్ అంటే క్లోజ్ చేసేస్తాను.
అప్పుడే క్లోజ్ చేసేసాను.
మేడం అన్నారు కంటిన్యూ చేయాలి.
అది కట్ చేసేయండి. ఒక వీడియో ఒకటి పెట్టండి.
మీరు రెడీ అంటే చెప్పండి. ఇప్పుడు ఈ టెస్ట్ మ్యాచ్ అయిపోతే ఓకే ఎంత మేము అయిపోతుంది కదా 3-4 hours.
Hello, I'm Ram from Medfile, and I'm here at Sparsh today. I'm here at an event hosted by Dr. Priyanka. It was a great event. Had a lot of talked to a lot of doctors. We had a lot of great time. Had a lot of information shared with one another. They focus on